There we go, I believe. Yeah, that's the one. That is the one. Oh. Yeah, that's better. That mic needed a good old stretch out. But yeah, apologies there. Fucking audio issues. Just moving the old desktop computer in and out of the studio. Just unfortunately because it's not the greatest location to be leaving a computer out overnight and all of that stuff. You know, dampness and all of that crack. Teresa, what is happening? Nice to see you out there in the hot box. Hope all is well. It's been a bit of time. Hi, happy Thursday, Martin. Hope you and hi Thursday, Martin. Hope you and yours are good and no sound. Yeah, nice one for the heads up on the sound there. I was literally asking, could you hear me out there as you typed that up? So sound. And yeah, definitely helps if it's plugged in, alright, for sure. But yeah, as I say, I've just been shifting equipment in and out of the studio just because of kind of just humidity issues at night time out here. It's kind of grand to come out here during the day, stick on the old rad thing inside in here, and the humidity doesn't be long dropping. But yeah, don't want to have the fucking computer breakdown on me again because of that. But once bitten, twice shy. This meeting that's happening today, let's have a quick look at the schedule for the speakers. But there we go, I believe this should be the one. Boom. So we've Miss Rachel Woods, Assistant Secretary to the Department of Justice, Home Affairs and Migration. So it'll be interesting to see what they have to say because I definitely know that there's a rise in migrant gangs getting involved in drug dealing. Definitely hearing of and seeing some of that. I believe there was a big raid actually up in Limerick yesterday on a Nigerian gang. So it'll be interesting to see probably new developments for them, but if we're kind of seeing it at the ground, hopefully that's kind of trickling its way up to these guys and they might be actually interested in doing something about it. Miss Mary O'Regan, Principal Officer, Department of Justice, again, Home Affairs and Migration, likewise, similar comments. Are we just going to get more of the toe on the line, the status quo and all of that crack, you know, more guards, more prisons? Let's see. I always remain hopeful anyway, like, you know, it's hard not to be pessimistic though. Assistant Commissioner Angela Willis, Organised and Serious Crime on Garda Síochána. Like that in itself, organised and serious crime. Like, serious crime should be standalone. Serious crime and like organised crime. To be fair, organised crime it's not serious crime. It's made serious because of prohibition. But it's not really serious. The two shouldn't be grouped together. You know, they should be standalone, and that in itself just shows how resources are wasted on things like organised crime. Organised crime is crap, but the best way to tackle it isn't on Garda Síochána. The best way to tackle it is, look, fucking the demand isn't going away for these substances. Harm is only being increased by the policy to try to make that demand go away. It's time to put their hands up and fucking admit that it's failed. But are we going to get that from the guards? Most likely not. They really need to do a survey of the actual guards that are out there on the beat, on the street, showing up in court, as to what their opinions and thoughts are on this, because what we're getting here is top down, not bottom up. And it's the guys, unfortunately, at the bottom, for lack of a better term, you know, the guards out there on the street, are the ones who really need to be kind of giving their opinions and thoughts on this, because they're out there enforcing laws and policing communities. You know, they're on Garda Síochána, they're peace keepers. Enforcing prohibition isn't keeping with the peace. Detective Chief Superintendent Séamus Boland, head of the Garda National Drugs and Organised Crime Bureau and Garda Síochána. Again, likewise, what are we going to get from them? I'm interested in hearing what they have to say, more than most people. Oh, here we go, it's in public session, it's about to start. It says, Mr. David Leach, Assistant Secretary, Department of Health, Professor Eamon, National Clinical Lead for the HSE Addiction Services and the Department
Voice members
of
that
Health.
we are in public session. Apologies have been received from Deputies Maura Devine, Senators Yvonne Quillen and Nicole Ryan. Before we begin, a note on privilege. I remind members and witnesses of the long-standing parliamentary practice that you should not criticise and make charges against any person or entity by name or in such a way as to make him or her identifiable or otherwise engage in a speech that might be regarded as damaging to the good name of the person or entity. Therefore, if your statements are potentially defamatory in relation to the identifiable person or entity, you will be directed to discontinue your remarks. It is imperative that you comply with any such direction. I'd like to remind members of the constitutional requirements. In order to participate in public meetings, members must be physically present within the confines of the Leinster House complex. Members of the committee attending remotely must do so from within the precincts of Leinster House. This is due to the constitutional requirement that in order to participate in public meetings, members must be physically present within the confines of the place where Parliament has chosen to sit. In this regard, I would ask any members partaking via Microsoft Teams to make you know that you're on the Leinster House campus. So, you're all very welcome. I am delighted to open the 17th public meeting of the Joint Committee, and this is their first module on legal issues to discuss the criminal justice and public health perspectives on legal and policy responses to drug use. I welcome our witnesses today from the Department of Justice, Home Affairs and Migration, Ms Rachel Woods, Assistant Secretary, Head of Criminal Justice Policy, and Ms Mary O'Regan, Principal Officer, Criminal Justice Policy. From the Garda Síochána, Assistant Commissioner Angela Willis, Organised and Serious Crime, and Detective Chief Superintendent Séamus Boland, Head of the Garda National Drugs and Organised Crime Bureau. And from the Department of Health, Mr David Leach, Assistant Secretary, and Dr Eamon Keenan, National Clinical Lead for the HSE Addiction Services. You're all very welcome. Opening statements were circulated to members in advance, and when you're ready, as agreed, witnesses will each have 5 minutes to deliver their opening statement to allow plenty of time for questions and answers from members. If necessary, further or more detailed information can be sent to the clerk to be circulated to members. I should also mention to our witnesses and members that members will be in and out because of the nature of the job here, so don't take any more into that than necessary. So our first opening statement is from Ms Rachel Woods. You're delivering your opening statement on behalf of the Department of Justice. You're very welcome.
Thanks, Chair, and thank you for inviting me to speak here today. As you said, my name is Rachel Woods and I'm the Head of the Criminal Justice Policy function within the Department of Justice, Home Affairs and Migration. The Department is fully committed to reducing the direct and indirect harms caused to society by illicit drug use through appropriate diversion and enforcement measures. The 3 main policy objectives we are seeking to achieve in this area are tackling organised crime, minimising the harms caused to those with addiction issues, and diverting people from involvement in crime and illicit drug-related activity. And work is ongoing in the Department in all 3 of these areas. I'm grateful for the opportunity to share with you some of the work we have undertaken in relation to the Government's health-led approach to drugs use, as set out in the National Drug Strategy 2017 to 2025. The strategy recognised the need for balanced health-led approaches to reducing the harm that illicit drug use can cause to individuals, families and their communities. It advocates for a 2-pronged response that reduces both access to illicit drugs and the number of people criminalised by possession for personal use. While supporting vulnerable people who use drugs, it also strengthens enforcement measures against the illegal supply of drugs. Officials from the Department engaged with the Citizens' Assembly on drug use to consider the legislative, policy and operational changes the state could make to significantly reduce the harmful impacts of illicit drugs on individuals, families, communities and the wider society. Along with colleagues in the Department of Health, we've devised a health referral scheme or health diversion scheme for individuals in possession of drugs for personal use within the existing legal framework. While unauthorised possession of controlled drugs will remain illegal, the scheme will facilitate members of Garda Síochána to connect participants with appropriate health services. This will divert suitable individuals away from criminal sanctions, instead offering them a pathway towards treatment and recovery. The outstanding legal and operational arrangements for the scheme are currently being finalised, and it is anticipated that the scheme will become operational in the early part of this year. As a key priority of the National Drugs Strategy, the Department of Justice, Home Affairs and Migration and the Department of Health also commissioned an independent review of the Dublin Drug Treatment Court. The final evaluation is now complete and its findings are currently under consideration, with ongoing engagement with the court service and other stakeholders. The Department is working to implement the recommendations of the high-level task force considering the mental health and addiction challenges of those interacting with the criminal justice system. A key recent development is the Community Access Response Team, known as CAST, a partnership pilot between Garda Síochána and the HSE Midwest Community Healthcare Services. The initiative assists people who come into contact with law enforcement while experiencing situational trauma or a mental health crisis, many of whom also experience addiction issues, and aims to divert them away from criminal sanctions and towards suitable care pathways. Other recommendations of the task force are also being progressed. The government's ambition is that the next national drug strategy will support a society where the use of drugs is decreased, drug-related harms are reduced, and recovery from drug dependency is supported. The draft National Drug Strategy 2026 to 2029 was published earlier this month by Minister of State and Department of Health, Jennifer Moran O'Connor, and I understand that her department plans to communicate or to commence a public consultation on the draft strategy shortly. Thank you for your time today, and my colleague Mary O'Regan, who's with me here today, and I are happy to answer questions.
Thank you so much, Rachel. Assistant Commissioner Angela Willis, you're up next for the Garda Síochána.
Here, look, members of the committee, thank you for the invitation to address you here today on behalf of the Garda Commissioner. My name is Angela Willis. I am the Assistant Commissioner with organisational responsibility for tackling organised and serious crime. I'm accompanied by my colleague, Detective Chief Superintendent Séamus Boland, who is the head of the Garda National Drugs and Organised Crime Bureau. I've been a member of Garda Síochána for over 35 years, and I've worked in the drugs area at various levels throughout my career. I worked in the North Central Divisional Drug Unit based in Store Street Garda Station during the 1990s. More recently, I was head of bureau at the Garda National Drugs and Organised Crime Bureau and at the Garda National Bureau of Criminal Investigation. I have witnessed the devastation caused to families and communities through illicit drug supply and addiction throughout my career. Like so many of my colleagues across the organisation, I have seen firsthand and investigated the violence arising directly as a consequence of the illicit drug trade, up to and including organised crime-related murders. Today, my focus is on ensuring that our valuable resources are directed towards targeting the structures and supply chains of those criminal networks who facilitate drug trafficking. The functions of Garda Síochána are set out at Section 9 of the Policing, Security and Community Safety Act 2024. Our functions include the provision of a policing and security service across the state to preserve peace and public order, to protect life and property, to protect and vindicate the human rights of each individual, to protect the security of the state, to prevent crime, to prevent harm to individuals, in particular individuals who are vulnerable or at risk, to bring criminals to justice and to protect and support victims of crime, and to regulate and control road traffic to improve road safety. I set out each of the objectives as laid out in the legislation because the impact of the illicit drug trade on the consumption of illicit drugs is a unique crime, and it spans all of the listed functions. The illicit drug trade consumes valuable Garda resources and impacts negatively on communities. This is not a victimless crime. And Garda Síochána enforce the law as enacted by the Oireachtas. We are committed to upholding the law to ensure that Ireland remains a safe and peaceful country. A significant amount of our focus in the organised crime area is on disruption and dismantling of organised criminal networks responsible for importation routes, ensuring that Ireland is a hostile environment for global drug trafficking networks to operate within. This includes targeting off not only those who direct such activities, but those facilitators and enablers who operate within the legitimate economy, those who, through corrupt practices, enhance the capabilities of criminal organisations. We implement a multi-agency approach to enforcement, working collaboratively with our domestic law enforcement partners, the Revenue Customs Service and the Criminal Assets Bureau, as well as international law enforcement agencies. Drug trafficking remains a priority as defined in the Council of the European Union for 2026 to 2029, driven by the impact of the European Multidisciplinary Platform against Criminal Threats. Government has enacted significant legislation in this jurisdiction, enabling us in our efforts to disrupt and dismantle criminal networks. In particular, I highlight the organised crime legislation enacted in the Criminal Justice Act 2007, along with the use of the Special Criminal Court for trials associated with significant organised crime prosecutions. Our focus continues to be on network disruption, pursuing high-value targets, denying and depriving criminals of their ill-gotten gains in whatever format such assets may be held. As has previously been stated, Garda Síochána fully support the government's policy on drug use, and we will continue to work with all agencies and government departments to implement the new National Drug Strategy. The committee will be aware that we participated in the Citizens' Assembly on drug use, and we fully support the recommendations as outlined in that final report. We adopt a human rights-based and humane approach to our engagement with vulnerable people impacted by addiction, particularly drug addiction. Our focus is not the prosecution of those addicted to drugs, but on disrupting the drug trafficking supply lines and dismantling the transnational organised crime groups involved in the illicit drug trade. We coordinate our disruption activities nationally under Operation Tara, our proactive national strategy to enhance the organisation's capacity to disrupt, dismantle and prosecute drug trafficking networks that are impacting on our communities, and to ensure that we're keeping people safe. While the Garda National Drugs and Organised Crime Bureau is tasked with disrupting and dismantling of transnational organised crime networks, we also have divisional drug units in every part of the country focused on street-level drug suppliers who inflict so much harm in our communities. In the 10 years since the Garda National Drugs and Organised Crime Bureau was established, illicit drugs at an estimated street sale value of €756 million have been seized, and that's in addition to €36 million in cash and 171 lethal firearms. Drugs-related intimidation is a priority for Garda Síochána, with significant effort in progress to identify the scale of the issue, the perpetrators involved, supporting victims and ensuring the policing response is adequate. Garda Síochána is often at the forefront of supporting families in such situations. We've developed a strategy to counter drug-related intimidation, which involves collaboration with external partners and links with the Department of Health's Drug-Related Intimidation and Violence Engagement project. We can provide further details to the committee of our work in this area if required. Garda Síochána continue to support our partners in a number of initiatives designed to prevent drugs harm, including the Early Warning Emerging Trends Committee, the Festival Back of House Monitoring Committee, Supervised Injection Facilities and the Health Referral Scheme. Garda Síochána are fully supportive of diversion of persons from the criminal justice system where appropriate. Our organisation has significant experience in this area through the implementation of the Garda Youth Diversion Scheme for children under 18 and the Adult Caution Scheme, which is available for a range of summary offences, including the possession of cannabis for personal use. Regrettably, illicit drug consumption is becoming normalised across many areas of society with ever-increasing demand. This in turn has resulted in greater profits for criminal organisations, leading to an increase in threats and intimidation as violent criminals seek to maintain control over their illicit business. This is a supply versus demand industry which is nourished through consumption. Unfortunately, many people who consume illegal drugs are disconnected from the local, the global devastation and violence that results from consumption. And Garda Síochána will continue in our efforts in law enforcement environment. However, the true power to impact on this issue rests with education, prevention and the personal decisions that are made by the citizens of this state. We welcome your questions and of course we'll provide the committee with any additional information that you may require to progress your important work.
Assistant Commissioner Willis, thank you so much. Mr. David Leach, you're up next.
Thank you, Ciara. Members, thanks for the opportunity to attend today's meeting once again. I'm joined by my colleague, Professor Eamon Keenan, National Clinical Lead for HSE Addiction Services and Clinical Professor in Addiction Studies at Trinity College, Dublin. The report for Government Securing Ireland's Future reaffirms the Government's commitment to a health-led approach to drugs use, and it is the role of the Department of Health to provide leadership in delivering on this commitment. Under the last National Drug Strategy, there has been significant progress in this regard. An independent evaluation of the strategy noted that notable progress has been made in advancing a health-led approach, particularly through the expansion of harm reduction initiatives. These initiatives are positioned as a central component of the strategy with a focus on reducing the adverse health and social impacts of drug use. The recently published draft strategy for 26-29 marks a further evolution of the health-led approach by delivering an integrated, equitable and evidence-based response to drug and harmful alcohol use. Investment continues into the provision of drug and alcohol services. In addition to the annual funding provided by the Department of Health for drug services of over €170 million, Budget 2026 included funding of over €6 million for several initiatives, including increased access to treatment for opioid dependence, including buprenorphine, strengthening workforce development in the drug sector, enhanced services for underserved populations, and providing an initial 30 residential treatment beds for people with complex medical needs and those who are homeless. The increased investment in drug services is reflected in the National Drug Treatment Reporting Systems data for 2024 published by the Health Research Board. This shows a record figure of almost 13,300 cases treated for problem drug use. This represents a 50% increase in the capacity of treatment places since 2017 and reflects the ongoing investment in expanding services. There were a further 8,750 cases treated for problem alcohol use, the highest annual figure for over a decade. Significantly, 5,500 cases reported both drug and alcohol use, highlighting the importance of integrated responses. There is a strong association between harmful drug use and homelessness. The Department and the HSE recently allocated extra funding of €1.9 million to the community care facility for people who are homeless run by Dublin Simon Community at Ushers Island. With 75 beds now open, the facility is expected to deliver approximately 1,000 treatment episodes per annum. Services provided at the facility include alcohol and benzodiazepine detox and stabilisation, bloodborne virus stabilisation and low-threshold addiction recovery. Total annual investment by the Department and the HSE in the facility is now €10.4 million. In December 2024, Merchants Quay Ireland opened the country's first supervised injection facility for a pilot period of 18 months. As of November 2025, the service assisted 1,500 clients who have made over 17,000 visits. Over 270 non-fatal overdoses have been treated in the facility. An interim evaluation at the facility highlighted positive findings in relation to the qualitative experience of those accessing the service, the success of the service in accessing those with high levels of vulnerability, no increase in the frequency of ejecting behaviour, the promotion of safer injecting practices, and the number of overdose and medical interventions performed in the facility. A separate academic paper identified a reduction in drug use and drug-related litter in the local area and increased levels of community engagement. The programme of government commits to increase the availability of naloxone used to reverse opioid overdose and to train more people to administer the drug. During 2025, the HSE supplied 4,571 units of naloxone to services nationwide, and over 3,000 people have availed of opioid overdose awareness and naloxone administration training. There were 412 administrations of naloxone recorded in 2025, equating to 16 lives saved. The Department of Health has funded and supported the development of the DRIVE project, as was mentioned, to combat drug-related intimidation and violence, and continues to provide recurring annual funding of $250,000. The Department is committed to funding harm reduction services and early warning and emergency responses to novel drugs and emergency trends. The Department has provided additional funding to the HSE for harm reduction initiatives to provide a rapid response to the threat of synthetic drugs, including a wastewater drug surveillance programme and an early warning programme in acute hospital settings during 2026. The HSE Safer Nightlife programme, running since 2022, extends the health-led response to drug use in the nighttime economy, including free and anonymous back-of-house drug checking at selected events. This programme identifies drugs in circulation and provides vital information to help reduce harms for people who use drugs. In November 2023, a health-led approach was integral to the response to the emergence of a powerful synthetic opioid in the drug market. This outbreak resulted in 57 overdoses over the period of 5 days in Dublin and a further 20 overdoses occurring during a second outbreak in Cork. The response, led by the HSE and supported by Garda Síochána and other stakeholders, ensured the harms from this drug were minimised. Considerable progress has been made towards implementing the Health Diversion Scheme. The Minister for State Responsibility for Public Health, Wellbeing and the National Drug Strategy and the Minister for Justice, Home Affairs and Migration have agreed that the scheme will commence on an administrative basis. The scheme will refer individuals found in possession of drugs for personal use to health services and avoid a criminal prosecution. It is important to say that drug possession will remain illegal, but people with illicit drugs for personal use would be afforded, first and foremost, the opportunity to engage voluntarily with healthcare services. The operational details of the scheme are being finalised by Garda Síochána. The HSE has in place a regional network of 10 healthcare practitioners, 9 whole-time equivalents, who are ready to provide a screening and health intervention known as SARE once Garda Síochána commence referrals. SARE uses a short, person-centred approach based on motivational interviewing to have a conversation with an individual about their drug or alcohol use and refer those presenting with more complex needs to specialist services. SARE can be delivered online or in person. Brief interventions have been shown to be effective in initiating change in consumption for people with mild to moderate alcohol drug problems and helping people with more significant difficulties to access specialised treatment services. Thank you for your attention. We're happy to answer any questions you may have.
Thank you, Mr. Leach. Members, over to yourself. You each have 7 minutes. There was a distributed before today's meeting, and Senator Loran, you were first up for the people here.
Okay, thank you, Chair, and thanks everyone for your contributions. I'm going to do my best to ask my questions in order of the relevance that I think they are, and maybe this one is specifically for Garda Síochána in relation to what is being called a health-led response, but is, I suppose, in my view and many others' view, a police-led response. And I'm wondering in relation to if an individual is found with a substance, is it correct to say that that individual has to admit the offence before they actually know if they will be diverted or not in terms of the discretion?
Good afternoon, Senator, and thank you for the question. So the proposal that we are very supportive of in Garda Síochána will involve engaging, obviously, with the person who has been found in possession of a quantity of a controlled substance which we believe is for their own personal use. The health diversion scheme is a non-sanctioned outcome, so obviously they will have to acknowledge what the substance
Yes.
is. But then, while we will keep a record of that engagement with the person, once they consent to be diverted to the health intervention and to the SARE team, that's it over from the perspective of Garda Síochána. So there's no further engagement then in relation to the substance.
But they don't know if they're going to be diverted. So if an individual says, so they're required to self-incriminate basically and say, yes, I'm in possession and it's illegal, like of an illegal substance and it's for my own personal use, but it's only after that then the maybe arresting guard or the guard who has found the person to be in the substance doesn't actually have the discretion in that moment as to whether that person will be given a health diversion or not, because it is discretion. So some people won't. So it's not automatic that you will go through the SARE process, even if you admit the offence.
It will be automatic on the first occasion.
For everybody?
For everybody, on their first occasion that they're
Okay.
encountered with controlled drugs. So it's not a discretionary piece. And we've actually been very, we've put a lot of effort into making sure that we're supporting the members on the ground in that decision-making process, that they're not being asked to use their discretion. It will be very clear, and the policy will be very clear that on the first occasion there will be a health referral made, subject to the individual agreeing to having that referral made, and obviously they have to agree then that we provide their information to the department.
So on occasion then 2 and 3, then there's grades of discretion that come in relation to whether a person will be provided with an adult caution or not? Are we saying on the second time an adult caution will be automatically given, or at what point does discretion kick in?
It will all depend on the individual circumstances, and it will depend on the history of the individual. And in the event, the policy is not finalised just yet. So what I'm giving you is the broad outline of what it might look like. So what it could look like is that if the person, say on the second occasion, so the first occasion is a blanket, they will be referred, and that's it for all drug types. On the second occasion, so the adult caution at present provides for an adult caution in relation to cannabis use. So it doesn't provide it in relation to other drug substances. Now that is something that can be revisited down the line, but at present that is the way it is laid out.
Because obviously, like, you know, I'm enthused when I hear that the Garda Síochána support the findings of the Citizens' Assembly recommendations. But then in practice, what we have and what yous have to, I suppose, whether that's on instruction from justice, but it's not actually a health-led approach, you know. So it's, if at any time you can all of a sudden be a criminal for the thing that we're saying is a health issue, well then, you know, it is remaining a criminal response. Because if I have an addiction, the likelihood of me not having that addiction the next week when I encounter a guard again is really unfair, unrealistic, not health-led approach, not understanding the nature of addiction, not understanding the nature of trauma. So if I can go from it being a caution or a potential later on a conviction if it continues, that doesn't understand what the Citizens' Assembly has recommended in terms of decriminalisation of all substances. So there's kind of a mismatch in the policy. And I understand that people are dealing with what they can deal with within their own departments. So, you know, if we're accepting we can deal with something on an administrative basis, even on the forced protocol, when somebody forced gets caught on the forced time with something in their pocket or is found to have something in their pocket, the fact that we've shown an administrative sanction can be used at that point, we've proved that administrative sanction can be used. Why do we continue then to need to escalate it into a criminal sanction as it goes on? Because I mean, the arguments early on where we can't be Portugal because we're common law and we don't have, but we're shown there's an administrative something is happening. So it actually undoes that conversation in a way. So the fact, why do we need Section 3? Why do we need stop and search if we're proving that you can actually deal with it in an administrative way?
We can deal with it, so you can't uncouple the two things. So the guard will interact with the person who is found in possession of a substance for their own personal use, and they will be offered the opportunity to have a health-led intervention. And then the health-led piece has to kick in at that point. So we wouldn't anticipate that we'll be meeting that same person in an hour's time, because they'll have been referred on, and you've heard that the people are in place and it's ready to go.
But the next week, that person is not going to be out of addiction. Do you know what I mean? Just because they've had a health appointment doesn't mean that substance use ends. Do you know what I mean? Like, if the threat of criminal sanction or increased criminal sanction or adult caution, prohibition would have worked, because there's already the threat of prison. And people are still caught in either cycles of drug use, some harmful, some not harmful. So for me, it's not actually a health-led approach. It's still a police-led response. It's still a prohibitionist response, and it still doesn't actually take in the fact that addiction is complex, drug use is complex. So it's not even that I'm criticising what you are saying that they're putting in place. It's that there's something that we have to accept and stop calling it one thing when it's another thing, because it's quite misleading. Because, and I know the health department will say we don't have control over the justice administration, but the Drugs Act still is partly within the Department of Health, and the Citizens Assembly didn't recommend what's being offered here. And I just think it's wrong for us to keep portraying it as a health-led response when it actually is still a criminal response. Yeah.
We're going to have to move on, but we'll be back shortly.
I'll come back in. Yeah. Okay.
Deputy Brabazon, you're next on the list. That was.
Yeah, I just have one question really for the Assistant Commissioner, and thanks everybody for your contributions this morning. You mentioned, Assistant Commissioner Willis, you mentioned disrupting supply lines, and that's all really, really important work, and I think you mentioned that in the international kind of context, but disrupting supply lines on the ground in our local communities is equally important. And I think you'll probably acknowledge that there's a big problem with e-bikes and scooters and scramblers as well, and it's all part of that whole milieu. And there seems to be a contradiction between what your former Commissioner Drew Harris said at the Justice Committee. To me, he said it was possible for those people to be pursued, but middle management of Garda Síochána tell me that they don't want to do that, and they're not getting involved in pursuits. I know every circumstance isn't ideal for that, but there are circumstances when it could be done, and it could be done effectively. And I know the London Metropolitan Police Service have a particular way of dealing with those, and I think, denying the supply of drugs is the first step to preventing addiction. So I suppose there seems to be mixed messages coming from Garda Síochána in terms of pursuit. And what would you have to say about that?
So thanks, Deputy. Thanks for the question. So I suppose the first thing I'll say is that Garda Síochána are not the sole answer to addiction or to the whole drug problem. So that's the first thing to say. And in relation to your question around pursuit of e-bikes and e-scooters, there are significant complexities that you'll be aware of in relation to public safety in that space, if I can say it. So I'm aware of what the Met Police are doing in certain circumstances around certain types of behaviour, and I think it's more targeted towards robberies and snatching phones and that kind of behaviour. So our Commissioner, Justin Kelly, has stated publicly we are currently looking at all the range of options that might be available to us in Garda Síochána to tackle this issue, because we recognise that e-bikes, e-scooters and the behaviour of some people that use them is problematic. So we're looking at all the options, including pursuit. But if we are to engage in pursuit, there are many other issues that we need to take into account. For example, it's not just the person that might be on the e-scooter or the e-bike, it's the general public. We police for all of the community, not just the target maybe of a particular operation. And then the safety of our own members and the safety of the person who might be on that scooter or on that bicycle. So we need to, whatever direction we take, and if we do decide that we're going to pursue them and engage in pursuits, and we do engage in pursuits, but it has to be within the realm of safety, and our control rooms are specifically the dispatchers in the control room. Now I'm talking more about cars. When we engage in pursuit, it's not to say we don't engage in pursuit. We will engage in safe pursuit. So I suppose we're looking at other options around that at the minute, and we're looking at international practice as well, and to see what other countries are doing in this space. And then you'll be aware that there's consideration around new legislation as well. So again, we'll implement the legislation that's made available to us. And as I say, we recognise that this is a significant problem in some areas. We've engaged in lots of operations where we have seized scooters, and even recently out in DMR West, you might be aware from media reports last week, significant operations out there, significant amounts of e-scooters and e-bikes seized. And these operations are ongoing the whole time. I know when I was had responsibility for Dublin myself, we were constantly involved in doing operations, trying to target the people that were causing the most harm, doing operations and seizing the scooters, and in circumstances where we can dispose of them, doing that as well and not returning them.
Thanks.
Thank you, Deputy Brabazon. Deputy Graves.
I'll turn to the gardaí first, isn't it? Oh,
On the list that was put out earlier, Senator Fitzpatrick was ahead of you.
okay.
I'm sorry, that's my fault.
Okay, Gurmagus, Kirla, sorry.
That's fine. I want to stick to the road. If I lose it, I'll be gone.
Thank you all for being here today and for the work that you're doing. Assistant Commissioner Willis, the Gardaí get the brunt edge of this problem and challenge, and it is a society-wide challenge. And I really, what resonated with me in your statement, one of the things that really resonated with me is how you have personally witnessed the change in drug use in our society and the social acceptance of it, and the absolute disconnect between people who are consuming casually and socially and the devastation that it is causing in individuals and families and communities. I could get into the Section 3 debate, and I was interested in it, and I'll come back to it, because you also very clearly call out that the Garda strategy is to try and disrupt the supply and the distribution, and that makes sense. 750 million of drug seizures is a significant amount, and I've heard it referred to anecdotally that that's probably about 10% of the market value. So we're talking about 7.5 billion. You know, that's an enormous value in terms of illicit drugs in our society. I have two questions to start with, maybe the Department of Health. I'm really interested to understand the prevention strategy from the department. I think that there is inadequate ring-fenced funding for prevention. I think there should be, it's not to say that we should be taking the funding from harm reduction or any of the other areas, but I believe that we should have equal and additional funding for prevention. And we've had the school teachers, the unions representing them, youth services, we've had a lot of stakeholders in here, and I'd like to understand why the department is not prioritising greater funding for prevention. I'd also like to understand from the Department of Justice, your focus is on reducing the harm of illicit drugs. There's a cohort of people incarcerated in our prisons, 5,000 roughly, let's say, at the moment, 70% of whom are suffering from an addiction. And I think the number we heard was 49. There's places for 49 inmates to participate in addiction and drug recovery in Mountjoy. There's no intensive programme for women at all. So I'd like, if we could hear a response to those two questions. What is being done to adequately address the addiction, the pervasive addiction challenge in our prisons, and what are we going to do to increase prevention?
So, Chair, just on the prevention issue, I'll ask Professor Keenan to come in, but just to say we do fund the HSE to conduct prevention campaigns, particularly in education settings. I think the first thing to say is often when I discuss the issues of prevention with people of perhaps my own generation and around it, those of us that have children, we would love to see widespread communications campaigns around, advising people, going back to the 1980s, the Just Say No campaign in terms of drugs. I think that's kind of naive, if you know what I'm saying. We know from our own experience of public health campaigns in various ways, just telling people not to do something doesn't mean they won't take it. So it's a bit more, while we would all love to see something big and flashy, it would possibly be counterproductive, is what I'm saying, in relation to the population we're seeking to target.
I agree with you wholeheartedly. Okay. I suppose my question is what are we going to do about that?
Yes,
because
so Professor Keenan might speak, but we do fund work, but I agree with you, we need to do absolutely more, and hopefully under the new drug strategy we'll advance that agenda, Professor Keenan.
I think there was already a meeting with the prevention experts in relation for this committee. So just to reframe that, from a prevention, public health perspective, we recognise that there's three types of prevention. There's primary prevention, which focuses on stopping problems before they start. So that's in the context of substance use. That's around a comprehensive education, awareness, and putting in place policy measures that will delay or prevent that initiation. Then there's secondary prevention, which involves the early detection and providing support to prevent escalation. So, for example, that's preventing somebody from using occasionally to regular use. And then tertiary prevention, which addresses existing problems through treatment and recovery supports. And that aims to reduce the harms, prevent relapse, and minimise long-term impacts. So I suppose our previous strategy, Reducing Harm, Supporting Recovery, did have a comprehensive evaluation which was published. There were a lot of stakeholder consultations around that strategy, and I think it's fair to say that a key recommendation from both of those was the requirement to strengthen prevention in the next strategy. So the plan is the draft drug strategy was circulated to members of the committee, and I think when you go through it, we have specifically identified prevention as an area that requires additional resources and input. So that's at school level, tertiary level, secondary level, tertiary level, and really putting prevention firmly on the agenda for the government, for services as part of the next strategy. And I would hope that the consultation process, which we have engaged on the new strategy, reinforces our desire to have prevention as a key element of the next strategy.
Okay, Gurmarcus.
Thanks, Sandra. I'll acknowledge that there's significant issues in the prison service with overcrowding at the moment that is hugely impacting our ability to provide services and treatment. The department's approach starts with trying to divert people with addiction and mental health issues from the prison service in the first place. And we have a number of different pathways and programs for that, starting at the approach to the youth justice approach, which we're increasing funding in trying to prevent young people becoming involved with the criminal justice system at all. There are also pathways for diversion at the probation, at the court stage, pre-conviction, post-conviction, to try to get people into treatment. And there's various pathways to divert from the prison service. And the focus is very much on trying to improve and increase all of those provisions and increase funding into all of those areas. Once people do end up within the prison system, then there are other interventions. I'm going to ask my colleague Mary to just outline some of those. But I will acknowledge the overcrowding situation.
I think overcrowding is one element and it's absolutely a challenge. But I think regardless of the overcrowding, the evidence we've received is that there is wholly inadequate resources for people who are incarcerated to access addiction services.
There has been obviously a huge focus in trying to improve health anyway within prisons over the last while, whether it's to deal with addiction or mental health, and sometimes both are combined. Sorry, I have a cold, my voice is gone. I'm very much aware that Merchants Quay Ireland provide a service. I know they were in with you a couple of weeks ago, and I think you're specifically mentioning TARP in terms of how that is. There's a huge demand for those services, no matter how many places are provided. So I think you're always going to see an excess of demand relative to the places provided. There's been increased investment in health generally and the welfare of prisoners over the last while. So again, my understanding was that the Merchants Quay Ireland service to the prisons was evaluated. I suspect that evaluation will tell where the need is and what more needs to be done. So just to say, it's a kind of an evolving area in terms of just the care generally that we're providing to people and how they might deal with their addiction. And there are many other sort of services available within prisons that also deal with addiction in other ways. TARP is just one of those. So just to be
yeah, no, we're aware of that, and thank you. And I see I'm out of time, and we've got a vote, but I'll come back.
Yeah, thank you. Great. Thank you so much, Deputy Graves, for a second.
Look, I want to thank you all for coming in today. I think we're all very interested. We've seen the draft strategy, but it's of great interest to see how you see implementing, from a health perspective and a justice perspective. So it'll be really helpful to the work of the committee. I will start with the Garda Síochána, and it's a follow-up to some extent to what Senator Ruan said, because focus not being on prosecution for those addicted, but you spoke about normalisation of drugs in areas, and I see it where I live, it is normal. It's normal for people to use drugs recreationally. My question to you really is, how do you deal with the people that are stopped, that literally have drug for, a party they're going to or something like that, you know what I mean? They're not in addiction, and a lot of people don't actually become addicts. They use drugs, they use it because they choose to, and our services are already struggling, and for people to be referred to a health-led service when they actually don't want it or they don't really need it, to me is a waste of resources. So I'm just wondering how you would deal with that situation for the people that are not addicted. They're literally just have drugs in their possession for personal use. Should they be criminalised, just because they happen to be in possession? That's really my question. And my second question to you then is the drug-related intimidation is huge. We have it in every single community, even trying to kind of focus people and point them towards the services, but people are terrified. So I'm just wondering whether you think the new local community safety partnerships, could that be a role that they would be involved in as they progress? Thanks.
Thanks, Deputy. And I might turn over to my colleague in a minute, just in relation to the international experience around, you talked about recreational drugs. Not a term really that I would feel adequately reflects the connection that use of drugs has, and the people that you talk about that don't become addicted, and thankfully for them. But that whole disconnect between the harm that they're causing in the country of origin where the drug is cultivated, right through all of that criminality. We know that 40% of organised crime networks in Europe are involved in drug trafficking. We know that 60%
look, and I get that. My point really is our services are struggling at the moment, and to suggest that somebody that has drugs in their possession for their own personal use because they're going to a party or whatever they're going to do, and bleeding our services dry when we don't have them. We're already struggling to get people into health programs, so that's really the...
No, and I take your point. I suppose our target is not on those people. Our target is disrupting the supply routes. And I might just turn to Séamus just in relation to the international experience, and I think Professor Keenan might have a view as well in relation to that.
Yeah, thanks, Deputy. And in relation to the normalisation of drug use on the people who aren't addicts and are just going to a party, we do a lot of work with the Department of Health, we'd say, in the back of house examinations of drugs, particularly at music festivals, where there's a confidential analysis process that's in place with the HSE, where people can hand over, we'd say, drugs that they're using. And they can be analysed, and if they're extremely dangerous, you know, there's those type of harm reduction processes are taken. But I think it's very important in all of these debates that we always remember, you know, any research I read would still indicate there's still at least about 80% of the population don't use drugs. You know, and as a police service in this country, obviously our service is to all of the citizens of the state. The idea of the health referral or the health diversion scheme is going to be to try and prevent people from the harm that drugs use that can happen actually to them, so that we can make that referral. So that referral will be an administrative referral, so that it will not be a sanctioned process, and that's something that's very important. So we would hope, you know, there are such governance procedures built into the process, and then a review following a 12-month period. We would hope that at that stage we will be much more clear as to how successful it is or how successful it's not. But normalisation of drug use is a significant problem. You know, going back to the Section 3 discussion that has been raised on a number of occasions, what we have actually seen is other jurisdictions that have legalised cannabis, for instance, are now source countries for the illegal cannabis trade into Ireland, with multi-million euro drug seizures being seized on a regular basis. The criminality still continues. So we're trying to deal with it all in that way. But I think in relation to it, I think Professor Keenan may wish to address that as well. Thank you.
So maybe I'll just come in a little bit about the SARE, or the brief intervention, and talk to you a little bit about that, because I think that's a very important element of the health diversion programme that is going to be implemented. And really, just to put it in frame it, SARE is sort of an acronym. So it's using a person-centred approach to have motivation and interviewing. So you support the person, you ask them and you assess about their drug use, you offer assistance and you refer. Now, it's our estimate that maybe only between 10 and 20% of people will need an onward referral, but the brief intervention in itself has been shown to be an effective prevention and early intervention approach. So somebody who is using drugs, you say they may not be dependent on those drugs, but they may not realise the harms or the risks associated with those drugs. So, for example, ketamine is a drug which is now used widely by young people in certain settings, but many of them may not be aware of the bladder problems that are associated with ketamine. So the brief intervention allows an opportunity to have a conversation with the person about their drug use, to explain the risks and harms associated with drug use, and from that perspective can be an effective prevention and intervention at that point. So I think they will still benefit from getting a brief intervention from the health service through that SARE intervention, even if they are not dependent on drugs.
Okay. And the drug intimidation, probably on relation.
Yes, Deputy, in relation to drug-related intimidation, so there's extensive work has been carried out in Garda Síochána on this subject, going back to roughly 2013. So we have nominated and appropriately trained drug-related intimidation reporting inspectors in every division throughout the country. You know, we link in with the Department of Health's Drive project, which is up and running across the country at the moment also, and our drug-related intimidation inspectors are also participants in the local drugs and alcohol task forces, as is the local Drive lead in each of the relevant health service areas. So from the national coordination perspective for the Department of Health's Drive on Garda Síochána also sit on that forum. So you know, while there is daily and sometimes hourly interaction between Garda Síochána and the Department of Health in relation to drugs issues and early warning, we have the same systems in place in relation to drug-related intimidation, because we have seen this as a priority for the last number of years. It's an issue that we we know impacts greatly in local community safety and the harm. So it is a priority for Garda Síochána. So it is linking down to the local drugs and alcohol task forces where the experts are at the moment.
Thank you.
Deputy Burke.
Thank you very much. My apologies for being late, and thank you for the work that you are doing within your own respective areas. Can I just first turn to the opening statement from Mr. Leach in relation to, you know, the whole cost of drug services? You were referring to 170 million, and then you refer on to, you know, the increased number of people who are requiring care and treatment. I'm just wondering, you know, in relation to the whole education in this area, and remember, education now, we're cutting across a number of different departments, from justice to housing to education to health. Should we have a more coordinated approach between all the departments about getting the message out there, especially to young people? And I know, you know, you might say, well, that's the Department of Education problem, but are we doing enough in that area about coordination, about getting the message out there of the risks of getting involved and taking, you know, we're now turning out that, for instance, with some vapes that are dangerous to young people, and I'm just wondering, have we done enough work there, and could we do a lot more in order to reduce down the level of people who are, you know, getting involved in purchasing and the use of drugs?
Deputy, yeah, in relation to prevention, as has been said, it's clear we're not doing enough. You know, the evaluation of the last National Drug Strategy says that we can do more, and the new draft National Drug Strategy, which is submitted to committee members, states that we should do more and can do more. And as you know, Deputy, the National Drug Strategy is a cross-departmental, cross-government approach and includes nominees from the Department of Justice and from the Department of Taoiseach. I might ask Dr. Keenan just to come in and talk about the actual work we are doing in terms of prevention as listed.
Yeah, but like on the justice side, like it's in the up where the Gardaí end up dealing with it, but then, you know, it's appearing on the education side as well. But I'm just wondering, is there enough coordination between the government departments on it?
Well, Professor Keenan might just speak about the education perspective, because the HSE runs a programme in schools.
Well, that's the know the score evaluation, but I suppose you're correct. Any drug prevention system does require a very much coordinated interagency approach across education, health, child and family, youth, justice and community sectors, and they're all part of the work that's required in terms of prevention. And I'm hoping that the new strategy will specifically address that collaborative interagency work. And I just want to mention one thing that we're doing. Obviously, prevention has to be a population-based approach, and currently the HSE Public Health is conducting a national needs assessment for drug and alcohol prevention. So this looks at trying to understand both the underlying causes of drug and alcohol use, and then the current, what are the strengths and limitations of the current responses that we have in place. So they're going through a range of consultations and engagement with communities. There are focus groups, there's a national survey with the general population in collaboration with Ipsos, and a national survey of key stakeholders. So this is going to conclude in 2026 and will inform the HSE prevention effort in collaboration with all of those partners. The early findings from that survey indicate that there is a lack of comprehensive, coordinated and national infrastructure for drug prevention. So there's gaps in resourcing, there's gaps in training, there's gaps in staff support, there's gaps in research, and those all need to be resourced and identified in our new strategy, and this needs assessment will inform those responses.
Yeah, but in relation to then you want to people who have drug-related problems, we have a huge number of different agencies around the country dealing with it. No matter where you go to, whether you go to Cork, Limerick, you know, Galway, there are different agencies. Could we, dealing with all of that, could we actually have a more effective scheme if you had one overall agency dealing with the whole education issue, and then dealing with trying to coordinate the whole treatment and the backup support that's required for families?
Well, Deputy, it's long been the case that, a lot of the funding, a lot of the treatment is through, Section 39 organisations, as you know yourself from your own time. I mean, that has a lot of value. I mean, I think that local communities know best in many cases, and as Séamus has already said, there is a lot of value in local communities and in linking in with whether it be drug and alcohol task forces or the local, drug recovery services that we have in various places. I'm not sure. I mean, an effort to coordinate all of those services into one agency, I think, would be a huge task, and I'm not sure of the value of it really. At the end of the day, would it have a substantial impact in the delivery of services? I mean, I suppose if we were starting from scratch with health services, we'd have one agency as a preference, but we've kind of got here in many cases in healthcare. Because we got here in this way, and we have a patchwork of various Section 38 and Section 39 organisations, that causes challenges, but also sometimes presents opportunities because those organisations know their local communities perhaps better than we do at a central level, I think.
Okay. And can I just touch on the one in relation to Merchants Quay? You've given the figures there in relation to Merchants Quay and the numbers of over 17,000 visits, and it's quite clear from what you're giving here that the programme over the last 12 months has been a success there in dealing with it. I'm just wondering, looking at it now, is there now need to look at other centres around the country, whether it is Cork, Limerick, Galway, and what is the approach of the department to looking at that and identifying places where there is a need for that level of support?
So, Deputy, as you'll be aware, since you signed the order in the first place, yourself, to establish the supervised injection facility, that was a pilot and has been put forward as a pilot. It is working really well, I think, through cooperation with our colleagues in Garda Síochána, without which would be impossible. That service is working well, and it's been subject to a number of tweaks and changes over the last 12 months. I mean, we've changed opening times a little bit, they've changed the entrance there and done various things to kind of tweak and make it better both for those who use the service and for the local community. A full evaluation will now take place at the end of the 18-month period, and that will evaluate, as you probably know, Dublin City Council have gone for planning permission to extend its life beyond the 18-month pilot, and we will properly evaluate it. I suppose that will tell us then from there where we go next. I'm aware, and people in this committee, members of this committee and elsewhere have, requested similar facilities around the country, and indeed mobile facilities. We haven't got a closed mind about any of those things, but I suppose the evaluation will present us with options as to where we go next. But clearly, if this is a success, then it can be a success.
But the evaluation won't take place until the 18 months is passed.
It'll be a full evaluation at the end of 18 months, yeah.
How long will the evaluation then take?
So we've engaged Queen's University and Trinity College Dublin to do the evaluation. We've got a 6-month interim report. We have the final evaluation. Will be 18 months. We're expecting it to be published in September.
Thank you, Deputy.
Thanks.
Deputy Eamon.
Look, in fairness, as regards that piece of work on needs analysis, that needs to be done, and we need to provide that information. I don't think anyone will be shocked by the idea that there are gaps in service and what needs to be done. But look, if we talk about addiction in Ireland, we've never had a great relationship with alcohol right through. It's probably no shock that cocaine stepped into that place, and then it's how you address the issues that exist when you're dealing with, the impacts that drug addiction and drug crime has in working class areas, which are different as much as drugs are everywhere, and it is impacting on a huge amount of communities that wouldn't have necessarily fallen into that bracket before, but it's still a very different thing. And look, it's a matter of how do you tackle all of it, and that's right through from and we've seen it, the diversion programmes, we've seen it in relation to, we had Archways in front of the Children's Committee around, the use of Greentown project and whatever, those falling into crime. And here they got up and said, let's be clear, see with all these projects and all the great work, there has been an abject failure in the sense you're still dealing with families 3 and 4 generations in. So that is a piece of work that needs to be done. It's making sure we fill those gaps Garrett McGovern was in and was talking about the fact that, grand, if you're looking for something as regards opiates, but he says as regards, addiction services and benzos, that he said it's not necessarily as easy to access, not as much of it. So I suppose it's that idea of gaps, right? We all get the idea as well from the guards' point of view. We don't want the guards wasting the time of courts and their own time. We don't want people who need help and support falling into the criminal justice system. But at the same time, the guards also need an ability to deal with criminality. And we all talk about the war on drugs is lost. But here, we could all probably put out a number of names and say, my particular community would be better if X, Y, and Z were taken off the street, right? Or particularly the bad example that has existed in a particular area. And someone who might have had enough wit that they don't, let's say, engage in the same level of drug debt intimidation as somebody else who brought themselves to the fore. Because Séamus, I think it was yourself, obviously speaking after some of those brutal acts of drug debt intimidation that happened before Christmas. It was 169 criminal gangs in the state, 65% of them involved in drugs, 24 high priority. And I suppose I'm asking the question of how you wed all that, and how you also deal with the fact that there's an awful lot of people out there that don't think anything much, mightn't even develop a problem, will take cocaine and don't realise that they're paying money into these people who are making other people's lives an absolute misery.
Thanks, Deputy. Sorry, my mic was on. I realised I left it on all the time. Great question. And
I'd like that recorded.
Yeah. But you've outlined there. Look, we're on Garda Síochána. We're policing service to everybody, as I've said.
And you implement the law
in this jurisdiction. That's it. And it's the onus is on us to implement the law equally as well throughout society with everybody. The normalisation, we're back to the whole question again about the normalisation of drugs. I think there's a lot of public commentary. We've been very much to the fore in relation to our own media campaigns in recent times about the normalisation of drug use and understanding that drug use is occurring all across all spectrums of society, and a lot of the people who are using drugs do not see the devastation or the violent impact, or don't want to see it and won't accept it. I think Commissioner Kelly himself has raised that issue in public, and we've had a recent campaign ourselves about Every Line Funds Crime. So every opportunity that we're getting out there to highlight this to people, because we're very conscious, and we have always been, somebody who's going to make a decision to use drugs is a personal decision that person is going to make. Only education, hopefully will prevent them from doing that, which is what all of our different agencies and departments are engaging together. But it has been a difficulty for quite some time to get that message across, and we think it's extremely important. Talking about the education piece, we're a community-based policing organisation. We've links to every parish in the country. Our community police are engaging in our schools programs all across the schools as well, and we're inundated across the country, between whether it's sports clubs at the moment to try and get people in to talk to those people.
And I'll be playing football tonight very badly, I might add, with a number of your own members and also the youth diversion programs, and here stuff like that is absolutely vital. There needs more of it, has to happen earlier, build up those relationships. None of it is perfect. And as I say, we need to do those earlier pieces, but we still need yourselves at times to deal with those people that are having an impact on those they're selling to, and also on the communities that are impacted by.
And Deputy, that's why we're very conscious as well with all of the factors the Assistant Commissioner read out. All of our roles and responsibilities under the Act cover such a wide spectrum of issues across the country. But we're about analysis. Data is important. So the data from the likes of the health referral scheme, when it's reviewed, is going to be important to us. The data that we're analysing from cases of drug-related intimidation that we're identifying is important to us. The data of us analysing the level of crime, the crime gangs across the country, is important to us, so that our valuable resources can be focused in the right direction to have the maximum impact.
I think there would probably be a need if you could supply some of that information to us, because I think sometimes people miss out on it. They get something will happen in the news, they get focused, but they don't realise how prevalent this is, how impactful it is, unless it lands on their door in an awful lot of times.
Yeah, well, I think we have been public in relation to some of the data, particularly as you say, and it's an ongoing process. But 169 organised crime gangs, identified throughout the country, 17 of which are the responsibility of organised and serious crime in my own bureau to try and disrupt and dismantle and network disruption to impact on those groups. But the information on drug-related intimidation as well, because we have been collecting that information for a period of time since 2021. We must remember that's a confidential. And it's so sensitive, and it's a confidential process that we have. But data has been released previously when it's at such a level that it's not going to risk any form of identification of who the people are who are being intimidated, because our sole number one purpose is preservation of life, and our mission statement is keeping people safe. So we're conscious of all of that. So that level of analysis is going on in Garda Síochána. We would hope with the information that we're gathering, we will become more aware of what are the areas most affected by drug-related intimidation. It's important for us, you've hit the nail on the head, we need to know who are the people who are engaging in drug-related intimidation, because what we're finding, even from our analysis at the moment, is the majority of people who are engaging in that are young males aged between 18 and 24, but they are known to us. They're people who are already in the criminal justice system on occasions. They're people who have been engaging in crime, but we can prioritise the targeting of those people engaging in this activity.
I've seen that done locally. Yeah.
Sorry,
thank you.
I'm so sorry. Thanks, mate. With my questions now, if that's okay. Séamus, you mentioned something earlier. I wouldn't mind if you expanded on. You said source countries who've legalised cannabis, and we're now seeing an impact in our supply chain. So, which could you elaborate without breaking any operational secrets?
Yeah, yes, Deputy, and that's something that we've raised publicly previously. So my colleagues, in particular at Customs Revenue Service, who are really, the people at the points of entry into the state in relation to many issues, including this issue of drug trafficking. You can see it publicly in the newspapers, the significant seizures of cannabis that are occurring. Dublin Airport, for instance, in particular, where the source countries now for significant volumes of cannabis coming into this country are actually Canada, the United States and Thailand.
Yeah, and I suppose, because I can absolutely see where you're coming from in terms of the public relations campaign of every line is a crime. People need to be conscious of the global devastation that comes when you engage in cocaine, and fully accept that. But when you see that it's the US, Canada, and then it's cannabis, I mean, the devastation and the fueling of gangs, that actually starts at our airports, really, doesn't it? In the sense that they're grown illegally, we're getting the excess, that's fueling our gangs here, who are then engaging in the drug-related intimidation. So it's hard to see the global devastation for cannabis, because it actually starts off with fueling the drug gangs right here in Ireland, and that's based on our prohibition of cannabis.
Well, the cannabis being purchased and imported into Ireland isn't being purchased legally, even though it's being purchased in countries where it is legal. Mm-hmm. So it's a criminal logistics process from the beginning to end that's then actually coming over here. Like the devastation that we've seen, in other countries, I think it's fairly visible.
Absolutely. When you think about Colombia, South America, absolutely extraordinary. I suppose it's within that space. I do feel sometimes actually it's our own prohibition on that particular drug that's creating that market. In terms of, if it just turned to Section 3, what impact would the removal of Section 3 if the state took a recommendation? The previous committee recommended the removal of Section 3 of the Misuse of Drugs Act. What impact would that have on your work? And I imagine it would be quite significant.
Just in relation to the cannabis, Deputy, in 36 years in the Guards, I've yet to find a drug trafficking gang that only imports cannabis. They all import the same
No, I was only going
products.
back in terms that I was going back when you said the source countries I was actually just source countries being Canada, the United States So absolutely.
Yeah, in relation to Section 3 of the Misuse of Drugs Act, like Section 3 Misuse of Drugs Act, simple possession runs in tandem in the legislation with possession for supply also. So, you know, every person who's going to be prosecuted for a drug trafficking offence is also prosecuted for a Section 3 offence, a simple possession offence, because, you know, all drug trafficking offences aren't the truckloads or the carloads that we will actually see. And in fact, probably the most visible ones are the street level drug dealings that's taking place, that's impacting on local community. So there even are occasions where drug traffickers will have very small amounts of drugs carried around in their possession, or have other people carrying smaller amounts of drugs in their possession, as well as part of how their drug trafficking operation is actually working. So Section 3 of the Misuse of Drugs Act, the simple possession of controlled drugs remaining legal, is extremely important for us to be able to deal with drug trafficking and the issues surrounding it in itself, Deputy.
Okay. Is that the appropriate use of that section, though, in terms of the simple possession of drugs for personal use in Section 3? I mean, Section 3, the Garda Inspector report of 2014 found that power is being used quite extensively in terms of going beyond just possession or searching for simple possession. It seems to be something that's being used for more broader enforcement. Is there other powers you would need?
Well, no, the power of search is Section 23, which is the power of search if a member of Garda Síochána has reasonable grounds to believe that somebody is in possession of a controlled drug. So that's the power of search. If they're in possession of the controlled drug, it's then the determination has to be made, really, well, what is the purpose of their possession? Is it then for simple possession, or is it for the purpose of possession for supply? Okay. So it's the possession of the drug that is illegal, and that's the legislation as the legislation is laid out.
So you would still have that power to search and intervene if we removed Section 3 of the Misuse of Drugs Act, which is the debate that we have in this chamber for the last 8 months. So if you did remove Section 3, you'd still have the capacity to have wide-ranging search powers to stop.
No, I think the Section 3 is related to the possession of drugs, that somebody's in possession of a controlled drug, which is Section 3, which then the assessment is, well, what's the purpose of the possession? Like for a search warrant, it's Section 26 for a premises or a house or whatever. So you know, the reality in relation to the use of Section 23 as well, you know, it's not within our interest to be targeting people, and because people are users of drugs. You know, generally, you know, a Section 23 search will arise because something else has actually happened. You know, whether there's activity that has been complained about, or suspicious activity, or something happening in an area.
Yeah, thanks. I'm trying to move on if that's okay. We'll come back to my second round. From the Department of Justice, how much does the Department of Justice give to the DRIVE programme? Yeah, I know. I actually understand it is funded from the Department of Health. I get that, but I suppose I'm just
so we fund the programme, Deputy, and we have cooperation of 250,000 a year, and then we have cooperation from Garda Síochána.
That was the point I wanted to make, in the sense of there's been 2,500 incidents of drug-related intimidation since 2021. 250,000 seems like a very small amount given the scale of work that's needed.
Deputy, it's a community-based response. It is escalatory, so in other words, people engage with it as much as they want. So it isn't. We tend to. What we are trying to do with that programme is to support people who feel intimidated because of drug-related violence to the level they want to be supported. So it is the case that Garda Síochána have nominated local officers who will support people who wish to be supported in relation to Garda intervention in that. But I mean, what we're doing really is signposting to services that already exist. So the 250,000 is purely for the signposting, if you know what I mean. It's two services that already exist and are funded separately.
Does the Department of Justice support or fund any other initiatives in relation to drug-related intimidation?
We fund Garda Síochána, and that's where so the funding for their response to drug-related intimidation obviously comes
But
through
even
that.
drug-related intimidation working locally in the community?
No, we don't directly fund drug-related intimidation.
We'll come back to that now in a second. So I'm going to move on. Lynn, do you want to take her?
Apologies for having to go in and out of the chamber to vote. it's not my preference. So I actually think that's a really important engagement then that the chair had with yourself, Mr. Boland, because what I'm wondering then is under section 15 and section 15A, would you not still have stop and search powers that's not related to a premises but is to have enough suspicion for supply? And then obviously 15A I think is the level of supply increasing. So we had the Porto commander in here and we've spoke to other police forces both in the committee and then outside in some of our groupings, and they're very clear that they don't need a power like section 3 to find something like a section 15, that they're quite confident in their police force of having enough intelligence, intel training to be able to arrest somebody on the sale of supply, and that the evidence threshold would be at that level. So without the section 23, does prepare in section 23 to section 23, I think you said on section 3, that actually section 15A would serve that purpose if there was a suspicion of supply.
That may be the case, Deputy, but simple possession of drugs is and remains a criminal offence for all the reasons which were deeply discussed as well throughout the Citizens' Assembly. And you know, like it is important. It is an important factor as well with the work that we engage in.
Yeah, and I understand that it's still on the statute book, so you obviously have to adhere to that. I suppose why I asked the questions is really to expose the fact that we haven't moved towards a decriminalised model. And that's more than aimed at the public health department and people that understand social and public health policy, because I think in terms of what Commissioner Willis said, I think I agree, like the guards are not the, you know, I'm paraphrasing, but the response to addiction and all these different societal things. And that's why I'm, I suppose, asking those questions to expose potentially why we don't have a public health approach to drugs and why Section 3 is so problematic to that, not necessarily questioning having to use Section 3 because it's currently on the statute books. So I just wanted on the record that Section 15 exists there. If we were to ever move towards the justice or, you know, government actually removing Section 3 and making personal possession not a crime, that Section 3 could be removed without impacting sale or supply.
Sorry, Deputy, can I just add one thing on that I had mentioned earlier? It's extremely important. We have had prosecutions of people who have been prosecuted, we say, for Section 15, and they have actually been not convicted of Section 15, but convicted of the Section 3. Yeah. So the determination by the court was that there was insufficient evidence that they had it for supply. But they were convicted of Section 3. Yeah.
Thank you.
Sorry.
Thank you. Another question I had actually for the guards, and then the final question, and so I don't have to repeat it, is and sorry if it's been brought up, but just in relation to the safe injecting facilities and maybe if there's any plans for rollout elsewhere, but also the consumption sites piece, how we obviously need to move towards there. And I'm just wondering if the department can comment on, I suppose, any discussions or efforts being made in that regard. But I might just ask the one final question. Am I right in saying that Ireland is a bit of an outlier, or, you know, is one of few countries that doesn't provide any rights, say, for a minor in relation to stop or search? I suppose I always have concerns about where policing decisions are made and communities that are more likely to be policed than others because of all other different activities and the reasons, obviously, that drive that, right? So I'm not debating the drivers of that, but more that some people will encounter stop and search much more than others, and then also minors not having the right to an adult present for a stop and search. And I'm wondering just maybe what the view is on that, and am I correct in saying that Ireland is one of few countries that doesn't permit the presence of an adult for a stop and search?
Thanks, Deputy. Thanks for your question. I suppose the important thing to say here is we deal with addiction, we deal with homelessness, we deal with mental health issues every day, all day, every day in some particular communities. In relation to children, we're governed obviously by the Children Act when we're dealing with children. And when we engage with a child and they're brought to a Garda station, the first thing we will do is look for a parent or a guardian. Now, in some communities, sometimes there are challenges in getting somebody to actually come to this. But what about street
stops and searches? So not to the point where they've been arrest has been made and maybe have been brought to the Garda station, but actually street stop and searches?
So obviously the logistics of having a parent with their child on the street, and in some circumstances where you might be dealing with antisocial behaviour, we spoke earlier about e-scooters and e-bikes, etc. We know the harm that's inflicted on communities, and as my colleague said earlier, we police all of the community, not just certain elements of it. So our members deal with what they face in front of them on the ground, and if that involves searching a child, usually they're brought to the station, and then we make every effort to bring an adult, an appropriate adult, whether if we can get a parent, great, if we can get a guardian, good, and then if we can't, well then we've often brought, you know, the likes of peace commissioners or an appropriate adult into the station if we need to engage further with those children.
Yeah, thank you. I think as a community worker, and then I suppose as a young person who very much came into a lot of encounters with Garda Síochána, it wouldn't have been my experience. Definitely there was occasion we were brought to the Garda station, but we were definitely stopped and searched repeatedly a lot as children in the estate, and it obviously can have it can affect relationships as well and trust with authority and the state. And I ask that from a place of, first of all, a child being a child and should have an adult with them within the law, I think. But I understand that it's, you know...
And I suppose, Deputy, just to finish that point, a lot of the work we do is actually trying to engage with communities and break down the barriers between the police and some communities that are more, maybe suffering more deprivation than others. And, you know, we spoke earlier about football matches tonight with other guards and children, and we've lots of projects where we engage with. And a lot of the guards, they give up their own time. They're not just the community guards that are there on their working tours, but they're actually invested in those communities. And you particularly see that in around the inner city areas. So we take a very human rights focus and a very empathetic focus to dealing particularly with children and trying to, as I said, break down those barriers and build confidence between the children that if they do find themselves in a situation that they need to call the guards, that they're not afraid to do that. We also have our schools programme where we proactively go into the schools, different programmes for different age categories, both primary school and post-primary school. So a huge amount of work being done in that space, and obviously then the JLO programme where we, the juvenile diversion programme again, where we have specific members trained in how to interact appropriately with children to try and divert them from harm. And just to say that juvenile diversion programme, I think 3 out of every children that are referred to that never reoffend. It's one of the most successful programmes that we run, and obviously we're supported by the department then around the projects that kind of fall out of that, and that we can divert the children into those projects to, I suppose, occupy their time in a constructive way rather than hanging around street corners, causing hassle, maybe engaging in behaviour that's causing harm or alarm to other residents in the community.
Thank you, Senator. Senator Fitzpatrick.
And apologies, I had to go and vote. And apologies also if this question has been asked and you've already answered. But just getting back to the Section 3, and I appreciate that the operational guidelines are still being worked on and are not yet finalised. But to the extent that you can speak to it, can you talk us through, earlier you had, in response to Senator Ruan, explained how if somebody was engaged who had illicit substance for personal use, or asserting that they had it for personal use at least, they would be given a caution and referred to the SARE project on the first instance. As Senator Ruan explained, addiction is not solved overnight, and so it can be an ongoing and lifelong process, and it can incur relapses from time to time. So can you talk to us what the thinking is, share with us the thinking on how subsequent events would be managed? And would it be sufficient that if the individual had been referred to the SARE project, had started to engage, had fallen out, was referred back, like where will the discretion be exercised? Who will exercise it? And how many times, I suppose? And I use times because that's a kind of a quantifiable, but maybe it's not the right measure. So I'd just like to understand how that is progressing and shaping up.
Yeah, so I'm going to turn to my colleague in a minute just to go into the detail of how it is envisage that it will be implemented. But I suppose the first thing to say is, we've heard earlier that there were 17,000 people walked into the supervised injection facility in Merchants Quay. We didn't engage with any of those people. So people that are suffering addiction are not our target. We're targeting the supply networks and trying to disrupt and dismantle those routes and that supply. So that's not our focus for a start. Where we do engage with somebody and they're in possession of a quantity which is for their own personal use, so there is no caution. So we will engage with them, and you've heard from Professor Keenan that engagement actually can be really positive, where you're imparting information around the harm that they're causing to themselves. And we talked about the people that aren't addicted as such to the substance that they're taking. But that brief intervention can be life-changing for them and actually can shape their future. And we know from the evidence around the diversion programme that we have for juveniles that they don't come back and reoffend in the vast amount of cases. So that intervention, that early intervention, it actually does work, and the evidence would support that. So in relation to your question around how many times, etc., I suppose we're going to do this as a pilot, a proof of concept, and then we'll evaluate it after a period of time, and we'll see. And along the way, we might end up tweaking it or whatever. But I suppose we're going to try it because we know that we're not going to arrest our way out of the addiction crisis that is there, but we will certainly a health intervention. And you can't take the police out of that scenario either, because then you have, other issues to contend with. So I might just hand over to Séamus just about the actual workings of what we are proposing around the health diversion scheme.
Right. Thanks, Commissioner. And Deputy, just to add, I think our ground zero or our first point of contact with addiction isn't normally just someone being stopped on a search and been found with a piece of cannabis or a piece of cocaine. There's generally something much more serious has occurred, or we're bumping into them into homelessness. So that's what tends to happen. In relation to the health referral scheme proposal as well, the people who will benefit probably most from that are going to be, they are going to be the people who it's their first interaction because of whatever circumstances have occurred, and they've not come into the criminal justice system. And I can just think, for instance, sometimes at a concert or something, and there's a security protocol and someone's found in possession of a controlled drug. That person will be given the option, that we can deal with this by the administrative process, and they will be given the appropriate information for them to go and engage with the health service and have their SARE project. That from our perspective is as much as we want to know in relation to that, and it's our intention, that there are specific governance structures that are in that as well, because it's important for us as an organisation to ensure that this is going to be delivered equally in every community and all across the country. So we've had significant investment in our own IT infrastructure in recent months, so that we will be in a position so that senior management in every division across the country will be able to monitor to ensure that it's being implemented correctly. It would be our hope that this proposal is a success, so that we never engage with any of these people ever again, some of them who may actually become members of our own organisation in the future. And if so, they would be the success stories. If somebody engages on a second occasion, it's why are Garda Síochána engaging with this person on a second occasion, and this is why I think the evaluation after 12 months is going to be extremely important, because we only engage with people because of the environment or the circumstances that are actually happening. So it's difficult to give a generalisation in relation to everything, but the internal governance and oversight from local management is there, that if a person is engaged with again, whether that person is to be prosecuted or whether there's the option of the adult caution, or the reality is, a lot of people that we engage with for simple possession of drugs, it's drugs found in someone's possession because of some other incident that has happened. It could be a public order incident, it could be a road traffic accident, it could be someone arrested for being under the influence of driving. It could be thefts. There are many reasons. So there can be many other aspects which I think we'll be all much better informed, we'd say 12 months after, when an evaluation has been completed, as to why numbers are certain numbers and how many people were dealt with again, and that analysis will greatly inform the process.
Thank
you.
Deputy Grace.
Yeah, just to return to the drug-related intimidation, it's probably a statement rather than a question. I've worked very closely with our local drugs task forces, which are superb, I have to say. What concerns me is they've basically been written out of the draft strategy in terms of funding and their position, but that's for another day. But I suppose in relation to statistics, what you would get would be statistics of people that would finally go to the Gardaí, and it doesn't happen a lot. So I think over the last couple of years, I have stood with families and they fought, 2 of them only, very successful cases, beginning to end. They were terrified, they were absolutely, and the only reason that they actually went through the process was because they had no option. They had no money. They literally couldn't get access to money to pay off those that were intimidating, and it was horrendous, and elderly people and whatever. So I think in terms of stats, what you're getting when it finally reaches the Gardaí is probably tip of an iceberg, but I do have to say our local Gardaí are excellent, and they deal with people in a really humane way and very sensitively. So that's kind of a statement more than anything else. On the Section 3 versus Section 15, and to put it very bluntly, is it a case where if you suspect somebody of being in possession for sale and supply, and that won't stick, then Section 3 is applied? Because I'm just looking, the penalties for both are exactly the same, which to me is a little bit strange, but is that a way of getting, somebody that is actually selling and supplying rather than having drugs for their own personal use? If it gets to a court situation, is that...
No, sorry, and I hope I'm not being misunderstood, and apologies if I'm explaining myself totally wrong. There are many circumstances throughout the country when we're dealing with local street-level drug dealing. People will carry, the people who are actually selling will carry a small amount of the actual drug. That's a small amount of drug which, if you go by the amount they have on them at any given time, unless you have other evidence, it will only be possible to prosecute for a simple possession. We see that regularly because our mobile phones have changed the whole system of street-level drug dealing compared to what it was many, many years ago. People don't need to go to a location to buy drugs anymore. The drugs come to them. Scooters, electric bikes, etc., and people coming and going and coming and going. So the only way in which you can deal with that street level, like the in-your-face drug dealing, and the methodology, because drug dealing and drug trafficking adjusts to our activities and to modern society. So the only way that we can deal with that is in relation to Section 3, Misuse of Drugs Act, and prosecutions for those people. So many of those people will be prosecuted, but the reality is we know they are drug dealers also as well, but obviously we can only deal with the basic evidence that's actually there. Excuse me, I hope that explains that one a little bit.
Yeah, no, and look, and I agree with you the way things are moving. I spoke one day here about scavenger hunts, which to me, every day I think I'm just getting older because everything moves on so quickly, but the idea that there'd be scavenger hunts for drugs, to me was just alien, but there you go. So that's it. Listen, thanks very much.
And if I can just finish, I can just add, if Section 3 of the Misuse of Drugs Act was simple possession became legal tomorrow, every drug dealer in the country will only be carrying a small amount of drugs that could only be used for simple possession. And remember, you heard that here. In relation to drug-related intimidation, just to say about the data and the stats that we have as well, we totally recognise the fear that's out there. I was a drug-related intimidation inspector myself for a period of time out in Ballymun. I dealt with cases where I actually never met the people who were being intimidated. There was intermediaries from some of the local health groups in the area that were interacting with myself. But the data that we're analysing is, we're looking at crimes that are being committed where there may be other information that we may have that allows us to go, this is drug-related intimidation. Sometimes those victims aren't even telling us. It could be their car burnt out, it could be an assault, it could be window broken, petrol bomb attack, anything like that. Sometimes the people won't admit to us, but we are satisfied and we are identifying that these are cases of drug-related intimidation. The motive for the crime is drug-related intimidation, and we are monitoring them and recording them on our system because we want as well to identify, people who are at huge risk and significant risk. I go back to what I said earlier. We need to identify who are the people who are engaging in drug-related intimidation so that we can pursue them. We've had significant long-term operations, part of our analysis. Even only in recent weeks, we've had a significant operation with a number of arrests for questioning even people who we believe are directing others to engage in drug-related intimidation, with our hope to present those people, hopefully, if we can gather enough evidence, before the courts, and that evidence being given that these are the people directing this type of activity. So we encourage people to come forward to us.
Okay. Thanks.
Deputy Burke.
Thank you very much. I just want to raise the issue in relation to, in the report in relation to merchants' key, you're talking about 1,500 clients, 17,000 visits, and I suppose the big problem about drug addiction is access to accommodation. A lot of people would have moved out of home. Some of them are in kind of inappropriate residential accommodation and not suitable to their needs, or else they're using a lot of residential night shelters, and some people are not even using those. But just in relation to facilities during the day and access to facilities during the day and supports during the day, we haven't really done an overall programme on that. We're relying again very much on the various agencies outside of the HSE, outside of the Department of Housing, outside of the Department of Justice. And I'm just wondering if that whole issue has been looked at as regards doing a far more coordinated approach about access during the day. And I suppose in particular I'm referring to as well where we want to try and do a day centre in Cork. And I know tenders have been invited on that. I'm not sure where it's going to progress over the next 12 months, but I do think it's important from the point of view of people accessing help and support, and then helping them to maybe go down a better road than the road that they're travelling. And I'm just wondering, where are we from a national point on that issue?
So just first of all, in relation to Merchants Quay and the service they provide alongside the SIF, they have other services for homeless people and for people in addiction. So a huge bonus, I think, of having the facility located by Merchants Quay is that the people who are availing of the facility have access to homeless and other supports that are available to them there. Now, obviously, we would all love if they engaged in addiction supports, but that's an offer to everybody that's there, but not necessarily one that they're particularly necessarily have to take up or would be a position to take up, but it's open to them to engage in so much as they can with homeless services, with addiction services that are there. We have a particular concern that about 4,500 to 5,000 people homeless in Dublin that are living mainly in private emergency accommodation. Single people in particular, they're a particularly vulnerable cohort. We do work with the Dublin Regional Homelessness Executive around a programme, a health programme, an intervention in each programme with them on a health basis. Many of them would have mental health and addiction difficulties. We do identify gaps, and I suppose that's why we put in place services like the Dublin Simon facility at Usher's Island, which offers support to homeless people in various ways, whether that be obviously our acute hospitals in Dublin also would provide, have a lot of social inclusion work that goes on and do work there, but the facility at Usher's Island provides about 1,000 episodes of care a year at this stage to that very vulnerable population. We would hope to expand and we're doing an evaluation of it this year. It's 75 beds are open, and we would hope to open it in full to 100 beds over the next period of time, and to provide more facilities there. But it's an extremely vulnerable population, Deputy, and we can always do better in terms of integration of services, working better with our colleagues in the Department of Housing, and we are currently working with them on a working group to examine how we might better support that population in particular.
But in respect of Cork, for instance, you have the HSE of different locations around the city,
yes,
whereas they want to focus on one location where a whole range of services would be available to people who are homeless.
Yes, so that population would be very concentrated in Senator Fitzpatrick's constituency, as you probably know, in the Parnell Street, or sorry, the Garden Street area, in particular. They're quite centred in Dublin city centre, and there are a range of facilities around there. In relation to Cork, which you mentioned, there is a commitment that we will open the homeless hub there, which would be a combination of housing supports through Dublin Cork City Council and the local HSE, providing health supports in the one centre in Cork City by the end of the year, which is replicating models that we have that work quite well.
But there are tenders accepted or that have been submitted. I'm not saying accepted, but have been submitted. Yeah. I mean, is that project likely to progress over the next 2 to 3 months, or is it?
Deputy, I think the last time we met, and you engaged with me quite heavily on the issue, I committed that we would endeavour to open the facility by the end of this year, and I think that I know of, we're still on track. But I'll get an update for you on it exactly.
And just in relation to around the country, I mean, you're not just talking about Cork and Dublin, you're also talking about places like Limerick and Galway. I mean, have we sufficient supports there to help people? Or are we relying very much on voluntary organisations or, Section 39 organisations to provide that support?
Well, any Section 39 organisation that's providing that kind of support would be funded by the HSE under the Health Act, obviously under Section 39 of the Health Act. So, I mean, we have facilities in Galway and Limerick. Are they adequate? I think 70% of the homeless population is in Dublin city centre, mainly is concentrated in one very area. But there are other areas like Cork that you've mentioned. I think we can always do better, Deputy. There's no point in saying otherwise. I think this is a very vulnerable population. We have an overall budget of 250 million a year for inclusion health services. Would I like it to be more? Yes, I would. And we hear for the various ways in which it can be improved.
And just on this issue where a kind of permanent, not permanent, but accommodation is provided for a period of time, have we sufficient connection with local authorities then, so that when the person has spent 3 to 6 months in residential accommodation, which is very structured, where there's treatment, where there's support, and then the whole idea is that they would move out into local authority accommodation, have we enough of a connection there for that to happen, or will it be a situation that people will end up in that what was supposed to be 3 months or 6 months ends up to be 12 months or 2 years? And I'm just wondering, are we satisfied about the way that's progressing?
So, Deputy, I suppose that we would, the Department of Housing would put pressure on us quite rightly to provide better health services for people who are homeless, and we would put pressure on the Department of Housing to provide homeless solutions for people, who find themselves in that particular. We are working with them on a working group currently to seek how to better address the health needs of that population. And one of the points we do make, I mean, if you take the facility at Usher's Island, what we would want the people who would end a period of care there for addiction would have somewhere to go. Now, the Department of Housing, not to speak for them, but they're telling me that they will deliver more social houses in 2025 than they have in a very, very long time indeed, and that they're seeking to mandate local authorities to provide more single-person occupant dwellings, which would be more appropriate for that population. There would have been a struggle for a long time to provide appropriate accommodation for that population. But, to be honest with you, Deputy, people spend far too long in that type of accommodation. There's no point saying otherwise. But we are seeking to address it and to provide better health services to them while they are in that accommodation.
Okay. Thanks very much. Thank you.
Deputy Morgan.
Just actually follow on from that. I would actually say, and I know we have Housing First, as a support from local authorities, but there's an issue, because I've seen it happen before, when you've had like a number of 1 and 2 bedroom, let's say, apartments that have come and play, and there has been an issue at times where you were dealing with those that would have come through homelessness, you're particularly dealing with those who would have addiction issues, and even at times that crossover with mental health, and it may have been an approved housing body, but they were not. on some level, they didn't necessarily have the holistic supports that were required, and we literally set somebody up for failure. And that could depend on where they are on their own journey, and then that creates a whole issue for the local authority, the AHB, and generally for the Gardaí. And it's almost back to what I was asking earlier, was, you know, that gap that exists, the need for, you know, and we'd be very interested in, you know, that needs analysis. And then if I could ask that very specifically as well in relation to where justice crosses over with health, and I would also say, like, it's almost, you know, children should also be part of that conversation as regards the department from a point of view of that early intervention piece. But my feeling is, for all the good projects, like I said earlier, we don't have what we need to deal with, you know, the issues that are out there at the minute, and we're not necessarily, you know, addressing those that are most vulnerable and ready to fall into the chaos that is, you know, drug crime, drug criminality and addiction, which can have detrimental impacts. We're also not always great then in relation to the wider community that are also impacted by this. And I would say the powers aren't there at times with the Gardaí, the powers aren't there with TUSLA, or, you know, the tools even, and that the local authority sometimes is, you know, even to sort some of these solutions, it tries to do them through transfers and harm reduction rather than being able to address it fully. Again, it's that thing of we need to put all the information out from a point of view of, I'm not even sure we're putting the right questions, never mind the right answers.
Of Housing First, the department supported Housing First last year, about 1,400 tenancies at a cost of about 7 million. So,
yeah.
I mean, it's a fairly significant, you know, cost per tenancy. You can see there's a fairly heavy level of support.
It won't deal with the whole cohort, and particularly if you have a concentration, and sometimes mistakes.
No, definitely. It didn't suggest we would, but
no.
I mean, I think you'll accept that it's a significant, and it's a model that seems to be working, but not for everybody. And we have to acknowledge there are particularly complex tenancies that, you know, families and that need particular forms of support, and we have done a pilot in Galway with a number of families that have been particularly hard to maintain a tenancy for a long number of years with high levels of support, and that seems to be working quite well. But like, these are very individual, tailored levels of support to high acuity families. That.
But if we had the perfect system, it was perfect, yeah. But like screening and then interventions at an earlier stage, because sometimes in some of those cases, I'm assuming you're coming 10 and 15 and 20 years, and sometimes 2 generations late to the game on it.
Yeah, and we don't have a perfect system.
No. Then the question earlier just about, I suppose, the gaps, and even around addiction services right through.
Yeah, I suppose to come back on that, you mentioned cocaine and the changing pattern of drug use that we're seeing, and that's very evident for addiction services. In some ways, we have to reorientate ourselves away from the traditional approach that we were dealing with opioid dependence, methadone clinics, buprenorphine clinics, and in some ways that was easy because you can prescribe a medication that will support somebody through their treatment journey. With the newer drugs, the stimulant type drugs, the cocaine, you don't have a medication to substitute, but you will have to deal with the mental health problems that are associated with these substances. So there is a real need for prescribing, maybe antidepressants, maybe antipsychotics in some cases, but the main interventions are going to be those around psychosocial interventions, and that's where we need to really ramp up our counselling provision. So you're right. As Secretary Leach mentioned, that we had over 13,000 presentations to treatment in 2024. The most common presentation was around cocaine. Cocaine has overtaken opiates now, as are in terms of treatment. We had over 5,000 people presenting for cocaine-related problems.
And then you have to be dealing with an awful lot of polydrug users, and that's
polydrug use is the common. So if you look at it at age groups, I think that's the easiest way to look at it. Under 19, cannabis is the main drug presenting with problems. Between 19 and 44, cocaine is the main problem presenting with problems. Over 45, it's opiates then. So our opiate using population are getting older. They haven't gone away, but they're getting older. They have different needs. So we really have to orientate and pivot our services, and that's why the new strategy is so important in terms of getting those psychosocial resources into place to deal with that. We mentioned also the newer types of medication that we're having for opiate dependence. We've got injectable buprenorphine now. That means that somebody may only have to attend the clinic once a month, and that should free up capacity within the clinic. So there's some things changing which are hopeful.
But that report in September should highlight some of the gaps that exist.
The gaps and needs was around prevention.
Yeah,
you know,
but that's specifically prevention.
Yeah, that public health gaps and needs assessment is around prevention.
Right, so there's probably a bigger
Yeah,
need
there's
for
no
review.
one piece, Deputy. I mean,
No, it's everything.
Yeah, we're also doing, there's a health needs assessment going on in the northeast inner city through the north inner city project, Deputy, to be aware of yourself, done by RCSI, that the department and the Department of Taoiseach are funding, and that should give us a wider health needs assessment into a complex population, but does include a high level of homeless individuals and high levels of people with drug dependency that will give us other insights, if you know what I mean. So there's no one particular answer.
Okay, the Department of Justice in relation, as I say here, it's that piece that involves yourself as regards those earlier interventions and the conversation with Department of Children and whoever else.
Yeah,
Where are
Deputy, in relation to 2 points made, our involvement in the homelessness issue, we're part of the work referred to by my colleague in health that's led by housing in terms of addressing homelessness for particular vulnerable communities and those coming out of the prison service in particular. With addiction needs and with our high risk of homelessness, and we're engaging in that. In terms of youth justice interventions, I'd just like to say two things. One, they're actually very successful in terms of the rate of youth offending has fallen.
They're now earlier, but they probably need to be earlier again.
Absolutely, and I agree with you. We have seen a reduction in youth offending. We've seen a significant reduction in the numbers of children in detention, and that's following into prison. The one category of people in prisons that's actually falling is the 18 to 24 group, and that's you can see that the effect of the youth justice interventions. But you're absolutely right. We need to shift this to earlier intervention, and that's what we have started over the past year or two to focus on concentrating interventions on the harder to reach, most complex groups, and it's a small enough cohort, but it's a very, very difficult cohort, and we are increasing funding into that area and trying to mainstream the lessons from the small number of projects, some of whom you've engaged with, that are active in that area with the very difficult to reach young people. And the other thing we're doing is we're funding youth workers in all of the projects to work with the 8 to 11-year-old cohort who don't actually have engagement with the criminal justice system themselves, but we're getting the referrals from the education system or their younger siblings, or they're from families or that we know are at high risk of becoming involved. So we're funding those youth workers to engage with those children. Again, they're small numbers, but they're at the highest risk of being the most complex.
We've seen green shoots where some of their siblings have even fallen into criminality that they didn't necessarily like. That can be huge.
Yeah.
It's soon are you cutting me off now? Yeah. No, I know. I wasn't taking it personally.
Yeah, I was taking it personally, but thank you so much. I just have a couple more questions. James, my turn now. Just to David, to yourself. For the first time since the 90s, the first draft of the National Drug Strategy doesn't seem to reference the persistent link between poverty, inequality and drug-related harm. There's no specific mention of poverty in the drug strategy. So is that... And I know the Minister has said on a number of occasions that drugs impacts all communities. We've heard lots of times now the words come in that drugs impact all communities in Ireland, our town, village, but it doesn't reference specifically that it doesn't impact all communities the same way.
Deputy, as you know, it's a draft strategy and it's been presented to yourselves, and we'll be opening a public consultation shortly and to allow people to feed into the strategy in so much as they want. I think there is a changed nature of the drug problem, as has been outlined. I mean, it was the case that the drug problem was confined initially, going back 20, 30 years to communities with deprivation, and it was largely confined to those communities and affected those communities more than any other. It is now, because of the nature of cocaine and its abuse, it's now in every community. We hear testimony at this committee and elsewhere from people from all sorts of areas, from very rural areas, that drugs are a feature in their community. So the link between addiction and drug problems and poverty that was there, as Dr. Keenan has said, it still exists, that opioids are a huge problem and are particularly, and I'm particularly struck by Deputy Muraku's point, he's absolutely right, that the the greatest impacts of the drug problem are to be found in communities of deprivation. That's certainly the case. However, it is the case that all communities, all families now in our society, for the first time, I think when we're doing a strategy, I think we can say that there is no community immune from it, that it isn't specifically an issue of poverty, but it's an issue of society. Now, that's not to say there aren't particularly acute needs in communities with high rates of deprivation, but it is, now, just to finish the point, Deputy, as you know, the Drugs and Alcohol Task Forces get €28 million a year from the Department of Health, probably 30 million a year this year, because an extra 32 million has been allocated to them this year. We have yet to engage with those Drug and Alcohol Task Forces to discuss how they may contribute in the future in that changed landscape, and we'll be shortly kicking off a process under the strategy in order to talk to them about how, you know, with the regional health regions now and the HSE and population-based funding, how they fit into that landscape. And, you know, clearly they will be advocating, and quite rightly so, on behalf of their communities, many of which arose from the original drug crisis that developed in the 1980s and 1990s.
David, I don't disagree for a second that drugs impact communities the length and breadth of Ireland. What I do contend strongly is they don't impact the same way.
Right,
so if you take the prison population of whatever prison you would like to go visit, I mean, inevitably you're going to find people from a particular postcode, you're going to find people who are from a particular form of disadvantage, majority made up there. So I don't really accept that the National Drug Strategy wouldn't actually be explicit in actually pointing that out.
Deputy, as I say, it's a draft for a reason. I mean, it'll take into account this committee's deliberations, it'll take into account the public consultation, it'll take into account engagement with the Drug and Alcohol Task Forces around their role and into the future. And the ultimate strategy will look different to the draft strategy, and that's why it's a draft and that's why we're conducting it in the way we're doing it.
Thank you, David. Just in relation to drug-related intimidation, again, I'm conscious, and I think the guards do fantastic work in relation to drug-related intimidation and across the board. There's been 2,500 incidents of drug-related intimidation as reported in December of last year. I think there's been a 40% increase between 2021 and 2025. There's only been a 4% prosecution rate in terms of prosecuting people for drug-related intimidation engaged in it. So despite the really great work the Gardaí are doing, where's the gap in terms of where we can see prosecutions for this very incestuous, just insidious thing that's happening in their communities?
Thanks, Deputy. Important to highlight that it's only, in the last number of years, it's only 2021 that we actually had the infrastructure to try and start recording incidents where the motive was drug-related intimidation.
So 2,500 since 2021. Sorry.
Since 2021, and it's like everything when we're trying to roll this out. You know, you will get increases as we become better at recording, etc. ourselves. So that's relation to incidents that have occurred that we're quite satisfied are the motive is drug-related intimidation. Some of those instances are where people have actually come forward and admitted it and made statements and have resulted in some very high-profile prosecutions and convictions actually in our courts where people have been convicted of crimes associated with drug-related intimidation. But a lot of people won't admit that drug-related intimidation is the actual motive. So as I said earlier, part of our process is to identify the people who are engaging in drug-related intimidation. So
can we do anything to support in terms of the recommendations that we'll be making in the report? Is there anything else you need in that regard? Well,
is that people come forward and have the confidence to report the matter to Garda Síochána, because it will be dealt with as discreetly as they wish. That's what we would encourage, because once we identify the perpetrators of this, we are targeting for other means. So while there may not be what would be considered significant prosecutions for the incidents we have identified, the people who are engaging in it that have been identified may have been prosecuted for other offences, which has resulted in them either being incarcerated or all of a sudden having other concerns themselves that they're not engaging in drug-related intimidation themselves. So it's such a difficult crime and issue to get exact statistics from. I would expect that those statistics are like everything, they're going to rise, which isn't an indication that it's getting worse. It's an indication that people will have more confidence in actually the systems and reporting it. And that's what we're trying to encourage. So eventually we will hopefully see a level of reporting, but our priority is identifying the persons, because we can use all the powers available to us. On some occasions, some of these people may have been people wanted on bench warrants who all of a sudden become high priority to find and arrest on bench warrants, which then removes them from their community and they're not engaging in drug-related intimidation, etc. So if this committee could do anything, we would just ask people, there are great supports, whether they're between ourselves or the Department of Health, on Drive. There's great supports and advice for people out there, and encourage that they come forward. I think Ireland is actually one of the leading countries in this area at the moment in relation to this issue of drug-related intimidation, and we have colleagues in other countries are often asking us about how we're tackling it and how we're approaching it. So we're encouraging people to come forward. We expect those stats to rise, but that's not indicating that it's getting worse.
I suppose since 2021 there has definitely been an increase in terms of the stats, 2,500 instances, but it's also been an increase in terms of arson attacks in the last 12 months. So at the same time, the stats are increasing, people coming forward, more aware of the Drive programme. The violence and the intensity also seems to be increasing. And
the statistics that we've identified for instances of drug-related intimidation have actually remained quite stable over the last 3 years. They've remained in the late 600s, but they're neither rising sharply or dropping sharply. But you are correct, arson is a heinous crime. The petrol bombing of houses and burning of cars, we've all seen the effects of it. It's a huge priority for our organisation in relation to all of those investigations. As I've said earlier, those incidents, we're treating those incidents in the same manner as feuding activity that we've treated in the past. If there's people and organised crime groups are going to engage in that level of violence and activity, well then they are priorities for us to investigate and to tackle up and to the decision makers who are in that, which is why even recently we've had significant arrests, and there will be further arrests later on as our investigations actually progress. So we need that message to get out. Anyone engaged in this activity can rest assured they will be investigated. It is our intention to bring them to justice.
Thank you, Séamus. We've done the full round twice, but of course you can centre.
Thank you. Just in terms of the numbers there, I just want to confirm, Professor Keenan, you said 5,000 individuals had presented with problematic cocaine use. Am I correct? 2024. In 2024, yeah. And I think in roughly the same period, MQI had 1,500 users of the consumption, the injection facility, correct?
For that 2025, up to November 2025, 17,000 visits by 1,500 people,
1,500 people, yeah. So it's like more than threefold the numbers in terms of the problematic cocaine use. And I think as a rough indicator, I do think that is indicative of, let's say, the change of drug consumption or substance consumption and the nature of the problem for us. And it's a very broad statement, but I think it is a good indicator. And I want to come back to the Department of Justice on the Drugs Treatment Court. We visited the Drugs Treatment Court, and the Drugs Treatment Court came and presented here with the committee. And as Séamus alluded to, I'm from Dublin Central, the North Inner City there, and you mentioned earlier the overcrowding in prisons, and I think it was last summer the prison service in their annual statement had said they had released something in the region of 1,300 individuals on early release, all of them non-violent, mentally ill, addicted individuals. And they were being released because of overcrowding in prisons. And I would say the vast majority of the 1,300 were released into my community, where we already have provided 70% of all of the emergency homeless accommodation, and where we're also providing a very significant proportion of all of the, not all of the international protection, but a good significant portion of international protection as well. So they're people with very challenged personal circumstances. They have very complex needs, and they are being put into a very diverse, dynamic, and at times chaotic environment in accommodations that somebody in the full of their health would struggle to do well in. So I was really struck by the Drugs Treatment Court, how the approach they take has the gardaí, the probation service, the education services, the health services, and the local authority from a housing perspective. And I just want to know, what is it going to take for us to get that facility expanded? Because it strikes me that drug treatment court, and I was speaking to a parent just last week who has a young adult individual who has mental health issues, who has an addiction, and who has been in Clover Hill and actually recently released from Clover Hill and is now in Gardner Street in a hostel, and actually was moved for the third time in 1 week. And their son, it was heartbreaking to talk to the parent, because he was saying that's better. It would be better. The son has come to the conclusion he'd be better off inside in prison, because at least in prison there's a stability to his day and there's a routine to it. And he's not in the drug treatment court, so he isn't getting the benefit of all of those additional supports. And so I'd just like to understand, I think the drug treatment court is great, but it's been a pilot for 25 years. So how do we move it from being a pilot to being mainstreamed? And more importantly, how do we have that facility outside of just Dublin?
Obviously, you know, there's an evaluation just been done on the drug treatment court, and I suppose that will determine what we will do next. There's no doubt that, I suppose, what works in a drug treatment court really is not just the court itself, it's about all of the other supports around it. And, you know, I spoke last week or earlier in the week about the need, excuse me, from a lot of these people not to come near the criminal justice system at all would be a preferable situation. And I spoke as well about what we're doing in the likes of, say, Limerick, where we have CAST, where that people who have mental health and possibly addiction issues combined are actually sort of being diverted away from the criminal justice system and away from a court-type disposal. So in a way, it's about trying to support people in the various different ways and how they interact with the criminal justice system. In some cases, it may just be that an early diversion will mean that they never come to a court and never end up with anything that beyond that. In other situations where, like in the drug treatment court, they're referred to a service. I suppose the piece that we need to work on is why are there so few referrals into the court that we have at the moment, and also if it is to be expanded or replicated, it's a combination. It's not just a justice issue. You know, it is that thing about those other supports. How can they be provided? So the evaluation obviously will assist us in trying to see what we do next. Obviously, the one in Dublin has been on a pilot basis, but a lot of it too is about what do we determine as a success from, say, the drug treatment court. You know, there's a high bar there, and a lot of it could be a deterrent for people as well to sort of say, well, they may not participate because maybe themselves they feel they may not be able to emerge from it, you know, successfully. So, as I say, we're looking at it. We'll see what that means for us, but we just need to make sure that at least the one that we do have works better. I think that's the space we're in actually at the moment.
When do you think we'll have the evaluation?
Well, I think the court service will have told you when they were in last week. There is some tick-tacking to be done with them, with obviously the Department of Health and the HSE and the others who provide the support around kind of the court as it is at the moment. So we would hope to, I suppose, bottom out those discussions in the relatively near future and hopefully have a pathway forward.
Do you think it would be possible for this committee to get a copy even of the draft evaluation?
Well, it's not published yet. It has to go to our own minister.
Okay.
Yeah, so we only recently received the evaluation, and we do want to have our own analysis of it and working with the court service so that we know what we're going to our own minister with to say what we're, you know, what our proposals are to do with this evaluation. So it has recommended some changes in the governance and various things. So we really need to think that through. So I would say within the next couple of months, but we do need to have a plan as to what we do with the evaluation. But as Mary said, the issue is really around the access to the services and to the supports that the drug court provides, as opposed to the court itself. Most of the powers that court has, every court has, and it's just that the drugs court has brought together the services. So we would like to be able to mainstream at least the referral pathways and the access to services through other courts. They don't necessarily all need to be a copy of the drugs court, because as Mary mentioned, the referrals are not huge even in the biggest population centre. So it might not be the way forward to replicate that model in other locations. Okay.
Thank you, Senator. Deputy.
Yeah, no, look, to follow on, I think we are all very taken with the drug treatment court, and I suppose that was your multi-agency response and harm reduction and I suppose whatever means and could be done from a point of view of moving that out of its pilot scenario and across the board. And like I thought it was really good from a point of view of you had the guards, you had obviously you had education, you had HSE, and everyone operating on the basis of trauma informed and dealing with the reality, and it was actually really good, I suppose, from a humanity point of view in the sense of how you dealt with these people, probably in a way they might not have been dealt with previously. I also get, Mary, that, perfect world, we would have more substantial earlier interventions and we would avoid as much of this as possible, which is why, Deputy Gannon was absolutely right on the fact that, this has greater impact in areas of high deprivation. So, and look, the guards more than anyone at times probably need that multi-agency response, and it's back to that point I made about you have some young fella in the wrong, let's say, council house who has the run of the place, and then unless he's caught absolutely red-handed and everyone has seen the wire, now it does happen, but even in those cases it still takes years. Now I know myself and a councillor of ours are looking at means with the county council from a point of view of something that could be done to speed up this in an interim scenario. But again, it's all those services that aren't there from mental health, from addiction, but also then there is a policing need or a local authority means of actually dealing with someone who's definitely in breach of their tenancy. And it's like we have rules that are from another time and place. So look, I'm going to ask the guards about that, but I'm also going to just to follow up in relation to drug debt intimidation. I not only have they seen the wire, everyone's realised that see where you can send in a cutout, you send in a cutout. So half the time it's some wee lad who also owes money that's knocking on somebody's granny's door. And it's the amount of resources that are required in relation to it. But as I say, I have a particular issue, and here I have a decent relationship with the guards. I've seen them take serious action against people, but sometimes I think you need to state how difficult it is, the amount of guards that are involved in putting a serious operation in place, whatever about getting lucky on the basis of intelligence or not, how long it takes then to get it through court and to have an actual impact while you've just been replaced by another squad who have come through. But I've seen people who've had houses taken off them, but they're still back in operation the next day by cab, and it's brilliant. But it just goes on. They've taken it on as that's the cost of doing business, and it's getting. And I get we are not going to. I think you used the term out-arrest this problem, but along with deviating people away, providing the services, we also need to be able to get rid of what are, particularly in working class areas, the bad example in the really nice house that's been there forever, or as I say, or the young fella that's doing it directly, possibly even in some cases outside of school or whatever, but in a council house being provided by the state. Yeah.
That's for the guards.
Oh, always, I said, it always falls to the guards.
And that's the problem, Deputy. So look, we absolutely acknowledge the harm that's caused, and I suppose in relation to drug intimidation, it's not the individual that's involved in drug distribution. It's the debt that they've accumulated, and then it's their family that become the targets, if you like. And a lot of the time,
it's a better money maker nearly than the original drug deal.
And that's the point. But I suppose just in terms of, so Séamus spoke earlier about it's only really since 2021 we started really proactively trying to identify cases that are drug-related intimidation, because there is no crime of drug-related intimidation, but it does manifest itself in criminal damage, your arsons, your burglaries, your assaults, etc. But the figures have remained quite stable since we have started counting them. If you look at 2021, about 450 cases that we could identify that had a direct motive of drug-related intimidation, and that goes up to 611 last year. And as Deputy Gannon had said earlier, about 2,800 overall for that 5-year period. Last year last year 611 incidents of drug-related intimidation, but charges 344 charges before the courts in relation to drug-related intimidation, and there will be a lag in terms of following up the investigation and actually bringing a prosecution, getting enough evidence for presentation to the DPP, and obviously the DPP ultimately determines whether or not a case will be prosecuted. And it is problematic, and it does need all of the agencies to come together, and particularly in housing situations where maybe the council are involved. And if you take like a flat complex or something, you can have one individual that's actually destroying the peace and harmony of that whole community. And that's why, as Séamus alluded to earlier, it's really important that we know who those people are. So therefore, it's really important that people report, because we can target them. We mightn't be able to have enough evidence to prosecute them for the intimidation because of fear, maybe, of the victims coming forward. But there might be something else, because generally they're not just involved in that intimidation. They're involved in drug distribution, or they're involved in whatever the other crime is that is yielding.
There's also harm reduction pieces that could be done 100%. Where we've seen people being put in the wrong places that have impacted, that have been overly, useful to them.
Yeah, no, absolutely. And listen, it will take a whole of system approach to deal with it, and it's not the guards. And I said it earlier.
I don't think even the conversations have been had. I'm certainly not blaming the guards. I'm not even blaming the other agencies. I don't think we've had the conversation. I don't think anyone has thought about the powers that would be needed. I think we're still operating as if it's the 1950s.
But I suppose there's a lot that has to happen before it comes to the guards. We're at the end of a very long list. So we talked earlier about prevention and about education, and I think it's all of those initiatives that need to be in place. We only come in at the end when, in a lot of cases, it could be or nearly too late.
Yeah, and could I just, one last point. I suppose it's my own interactions with the guards in relation to drug debt intimidation has been, for the most part, positive. I would say, even in scenarios where people do not. In some cases they want to pay, they want to do whatever, but I remember when Christy Mangan was the Chief Super, he was in houses that were suffering under drug debt intimidation, where people have said they decided not to pay, and you know what I mean, and the guards backed them absolutely. But even in other cases, it was the idea and the importance of, we get the information, even if those people are going to find whatever solution, and I get it, be it stigma, be it whatever else, not wanting anyone else to know about this. He says, once we know that they're engaged in drug debt intimidation, it means we can do something from a point of view of protecting, and then from a point of view of targeting them on that basis. While I still, there's obviously others that need to be targeted, because it's not okay just to be distributing for, 25 years. But I think that's a point that does need to be made. And sure, I'll put it over to you. You can obviously are far more au fait with this material than I am.
Just to add to that, Deputy, people, it's our experience, who are engaged in drug-related intimidation aren't just engaging in it on one occasion, and they're not just engaging in it against one person or one family. It's people who are engaging this all the time, which is again going back to how important it is for us to get that information. We've been pushing ourselves out there since 2013, trying to encourage communities, report it to us, report it to us, report it to us.
I've seen the huge level of discretion that has been used by guards, whether it's meeting people away or, as you say, using someone else. No, and absolutely necessary.
Yeah, absolutely. So we would hope, with the acknowledgement that it is an issue, we've made significant strides in relation to that high-level violence over the last 10 years of the drug trafficking groups because of the manner in which we targeted it. And that was through, again, as I say, analysis of the information we had, identifying, you know, who are the actual controlling people, who are the facilitators, the enablers. So the same methodology, because this is extreme violence, this is impacting on communities, that same methodology is what we're using here. You know, so I have absolutely no doubt. I have my confidence there's going to be significant prosecutions brought before the courts. Again, there's already been significant prosecutions over the last 2 or 3 years, but we need people to come towards us because, you know, if we have the information, we can start planning and we can focus our resources in the right direction and have the impact.
And then just finally, absolutely finally, I'm half a liar obviously in relation to that. Yeah, no, I get it. We won't out-police this and whatever else, but I would still say at times, like, guards have to cover an awful lot of particular issues, you know, and sometimes have to deal with the lack of, let's say, mental health services from a point of view. But these are issues that definitely need to be addressed, and sooner is always better. And it's just, you know, as regards resources in a very general way, if you could just, you know, speak to that. I would work on the basis that most guards would say, yeah, we need more, we need better, and we need it quicker and faster.
That's the same scenario for you ask police officers anywhere throughout the world, and we'll say give us loads of resources and more resources. Look, there's intelligent policing is ongoing.
Intelligence-led operation.
It is. It's all intelligence-led. The data that's out there is significant. We've a greater understanding in modern times of the benefit of data, the analysis of where crimes are happening. You know, we've our own data analysts employed and distributed all throughout the organisation, and they're a significant asset for us in relation to modern policing, which can help us focus even down to the simple issues of where uniform patrols or checkpoints should actually be taking place. So that's a huge issue. You know, everybody wants a police officer standing on their street corner and their estate. You know, it's not possible, and a lot of the times we have to understand, you stand in one corner, sometimes you're just pushing the problem around
People
the corner.
in that corner are usually happy enough with that.
Exactly. So,
Yes, I have to
that's
thank
what
you
we're at.
and thank all of you. And I've never met a Garda who hasn't welcomed more resources, or a politician who hasn't wanted more time to speak. So
I thought I was quite impressed that.
But you've pushed your luck a little now, Deputy O'Muraku, and it's my job as Vice Chair to call our proceedings to a close. I want to sincerely thank all of you for the work that you do every day. And really for your contributions, not just today, but throughout our hearings. Really important work we're doing, and couldn't do it without you, so thank you for that. And on that basis, I will advise that this concludes our public session for this afternoon. And our next meeting, this meeting is adjourned, and our next meeting will take place on the 5th of March at 12:30 p.m. and we will meet in public session. Gormagad.
And so you heard it there yourself. Meeting concluded. Next meeting to take place the 5th of March. Just noting that down here because I know I'll forget that in 5 minutes. Boom. So there we go. What are people's thoughts, opinions on that? Nice one, everybody, for contributing throughout the stream. Boom. There we go. But yeah, not surprised really there, the lack of, what would you say, the reluctance of the guards to admit, you know, the fact that they're fighting a losing battle. Prohibition isn't going to work. Section 3, that's their baby. You seen there as soon as Section 3 came up and they mentioned that, it was straight away the defence barriers came up. It's like, no, we need that. We need that to get the big guys, because sometimes we can't catch them for dealing, but we can get them for possession. Like he actually mentioned that they couldn't get a guy for dealing because there wasn't enough evidence for that, but they could do him for possession. Seriously, like, at the same time he was actually talking about, like, the same guards, whatever they were, superintendent, when they were talking about them supporting the citizens' assemblies, the recommendations of the citizens' assembly, supporting a health-led approach, but then completely going off script afterwards, away from that, and wanting to keep criminalising people for drug possession. You know, oh, we'll do the health diversion, guys. We'll do the health diversion into the non-existent services that are there for it. We've heard from all the service providers that they're under-resourced. The resources are centralised to places, you know, where people outside of that then can't get access to them. So the whole like message there is this insanity. Why? How are they not realising this, highlighting this, while they're talking? Like, what? Fair play to Lynn for calling them out in the way that she did. But why is it not just being pointed out that the health diversion thing is not going to work? It's not because they don't have the resources there. They're diverting them to where? Like, seriously. It's madness. If a person has an issue with their drugs, just leave them, come forward and deal with them as they do with any other drug. No, alcohol being one for sure. Like, they don't call them drug addicts, you know, they're alcoholics. A person who's addicted to tobacco, to nicotine, they're just addicted to tobacco. They don't even have a name for them, do they? It's just nicotine addiction. But no, they're both drug addicts too. But we don't call them that because we want to stigmatise this other community for reasons that are completely counterproductive to why they're doing it. It's, oh man. It's just frustrating. It really is frustrating. I know Tinkle thinks and Mega Yawn kind of laughing there at their important work. It is incredibly important work that they're doing, but they're not really taking it serious. Like, they're having a conversation about drug users while completely excluding the drug users. It's a committee, it's talking about drug use, so aka drug users, and we're not included at all. Like, Jesus, like we've been out there on the streets with megaphones, literally out in the streets with megaphones year on year at 4:20. You know, you see it there, the 4:20 news. Go on, get it. Yeah, there we go. And we've done that for years. You know, Luke Flanagan put his bill forward. And there's not been a conversation there around it. They've mentioned cannabis. They've probably mentioned HHC more than cannabis, I'd say. But they've mentioned it, but still no inclusion of the people who consume it. You have the group out there, Crown. They've not been engaged with. Like, they've got very good members there who could have easily been included in this. I've not got word that anybody's been included in coming in, contributing to that committee as a drug user in any shape or form. Oh, it makes us, there's no sense to it at all. So other notes that I have from that there kind of thing, yeah, drug consumers being to blame. Like, that's another thing that's really grinding my gears lately, is was it Jim O'Callaghan kind of started that trend there again lately. He's our Justice Minister, for those who don't know, and he was also a presidential election candidate who dropped out of the race because he got exposed for not giving back rent paid by a tenant that he'd evicted or something along those lines. They'd overpaid. I don't know what the crack was, but he kept the money anyway and he never gave it back to him, despite numerous attempts by the person whose money got whipped to try to get it back. Ignored like legal letters and all of that crack apparently. The same guy made comments about, you know, blaming me or you for consuming cannabis that were basically fueling the criminal underworld, the violence, the murder that's going on out there, you know. Madness. I'm just going to bump up my mic. Just noticed that it's maybe a little bit lower than what it should be, so forgive me if you've fucking headphones on and I've just deafened you. But yeah, that's getting really annoying, right? The blaming the drug user and the drug policy makers taking no ownership of the problem created by the drug policy itself. Like, completely ignoring the fact that regulation works, the regulation of alcohol works, the regulation of tobacco works, the regulation of drugs works. So we've proven that through regulation. Is it like fucking perfect? No. People still get addicted. People still get harmed. You know, it still creates problems out there in society, but It works. It works because the supply is controlled. The people selling it are regulated. You know, you imagine a person in a bar having a few pints and, you know, has a few too many, and they're taken care of. Hopefully in a positive way. Hopefully they're not what would you say, like a kind of an aggressive drunk. Hopefully they're somebody who's just fallen asleep in the corner, drinking too many. They'll get you into a taxi, they'll get you home. And it's all nice. They might say to you the next night, come here, I'm only going to give you about 4 pints there tonight. 6 was too many for you there the other night, or 8, whatever the case might be. 2 was probably too many for me. Get wobbly after that. But you know, it's better that the drug is provided in a controlled environment by a person who has good intentions in providing that drug, and is not just profit driven. Conversation about not-for-profit drug supply models is certainly one that could be had, but the need to end drug prohibition as it doesn't work is one that really needs to be had. And stop bloody blaming drug consumers for problems that you've made as drug policy makers, you know. But what else is there? Regulation is the blame for the illegal export. That was another one that actually got at me when your man brought her up about places that have regulated, legalised cannabis, you know, and now illegal gangs are set up there and they're exporting it, you know. These places have come hot spots for the exportation of illegal cannabis. So it's funny, you know, it's legal there, it's regulated there. Gary Gannon got him, in fairness, good afterwards, kind of saying, you know, that actually it's not legal till it gets here, that the people who buy it are only supporting a network that actually is here, and that the illegal nature of it here that creates that environment. And you look over there and it's actually none of that. You buy it over there in Thailand, Canada, the US of A, and there's no issues, do you know? You're not supporting drug gangs. You're supporting legal, regulated business models. You're supporting jobs. You're generating revenue. You know, you got him good, in fairness, in that one. But it was still absolute BS that this guy came in there as some sort of an expert and was able to come up with that absolute BS. That there's no real, what would you say, rational thought that the legalisation and regulation is what caused the illegal export. No, it's our illegal fucking country, a country where it's prohibited, that causes these gangs to go over there and export that. Like, I know of a number of people around the country that are basically running businesses from Spain here. They're just exporting cannabis on a regular basis to somebody here, and that person acts like a distributor for them, you know. And it's handy for them, you know. Cannabis is not legal in Spain. There's kind of a grey area there. But it goes on, and they're exporting it from there. They're not going to set up a club there because, you know, it's easier to just actually buy it in maybe bulk or from a connection who's supplying the club, and then export it themselves to having a little distributor business here, making way more here of the sale and supply of it, you know. To summarise, Martin, do you truly believe we are any way closer to legalisation and regulation than we were approximately 3 years ago when the first drugs committee kicked off? We're certainly closer, but how much? So I could answer and just stop there and say, yeah, we're definitely closer. But how much closer? Like, that's where it kind of takes a turn, you know, that positivity. Then, yeah, we're definitely closer. It's kind of fake. We haven't gone much further. There's definitely thoughts, opinions there that are definitely from the Stone Age. They're old ways of thinking. They're not progressive. They're not in favour of drug policy reform, as you quite rightly seen there. The Guards, they don't want to give up that Section 3. That's an easy one to stop and search anybody around the place. Oh, we think you have drugs in you because you're acting suspiciously. We smell cannabis coming off, yeah. Do you know? You're in an area that's known for drug dealing. Do you know, these are all reasons why a guard can stop and search somebody for a Section 3. And if they so wish, they can actually bring them back to the guard station, as I have first-hand experience of back to the guard station, because they want to strip search you, you know? I was 18 years of age, fair enough, I was an adult. But it was such a shitty experience to go through. Separated me and my cousin into 2 separate rooms. I've told this here a couple of times already. But separated us, searched us, and then tried to pressure me into actually telling them where I got the hash from. They knew my uncle, my cousin's dad, was a drug dealer, and they wanted to pressure us into it. But yeah, sorry, bit off. Yep. We're closer, but not a lot closer. I definitely think that the tide is turning. I do believe that the only way we're really going to get it done in any fucking time soon is the people guys come together, man. Prisons are overloaded. They can't lock us all up. If we just come together, protest this a couple of times, get out there, civil disobedience. You've seen what happened at 420 a number of times. I could probably pull up pictures here from Instagram. Well, I'll quickly look for them. But where we actually had the guards walking around us above there in was it the Phoenix Park, is that what it's called? The one next to the Dublin Zoo where the president lives. Phoenix Park. They were just walking amongst us as we were rolling joints, passing cannabis in amongst ourselves. It was a great day. It should be on my own profile here on Instagram. It's going back a bit though. But as I said, civil disobedience works. I've proven it time and time again. Alright, I've a suspended sentence now at the moment. 2 months suspended sentence for the next 18 months, is it? Something along those lines. But, I've already had a couple of convictions. I had nothing to lose. If people just came together in numbers, they're not going to be bringing us all to court. Scrolling down through this here and not seeing it. It was from a good while ago. Yeah, never mind. I'll abandon that because something went wrong here on the page apparently. But yeah, civil disobedience. I think people coming together, engage in civil disobedience around the country, not just in one location. Around the country, like a couple of people to go into their local Garda station takes balls now, in fairness, not to be bigging up what I did, but it is not an easy thing to do because you can become a target, especially if you're from a small community. I'm in a big city here. That makes it a little bit easier. So if you want, come on up to Cork City, let's do it here. Go down to your big local town, whatever it is, city. And do it there, go in with a little bit of cannabis, just tell them, look, I'm pissed off at being a criminal all along, give me my day in court, I want to go in and stand up for myself, I believe what I'm doing is a violation of my rights, which I think there's totally an argument for. I've kind of laid it out there a couple of times in the past, the violation of our privacy, and a numerous other things. I think it's, again, Article 42, 43, 44, something along those lines anyway, forgive me for not having it off the top of my head. Strip searching is inhumane. It certainly felt that way anyway. It was definitely degrading, that's for sure. But I was more annoyed about the fact that they were trying to pressure me into ratting on my uncle. It's like, no, boy, I'm not going to be telling you. And he's like, I know he gave it to me. I was like, no, boy, I actually had on me a couple of grams, two different bags, maybe 3 different bags of weed from Amsterdam. One of them was empty. Yeah, it was 2 with about a gram, less than a gram in them. At the time, I was smoking joints with tobacco, so probably had about a joint or 2 made out of each of them. But I snuck back a couple of grams, more grams than that. We smoked a good bit before we got to there, but anyhow, about 2 grams there of weed and about 4 or 5 grams of hash that I did give my uncle. At about a gram of another notch of hash actually that we hadn't got from him, but I told the girl anyway, no, I brought all that back from Amsterdam. That was my own, didn't get nothing from my uncle, don't know what you're talking about, he's not a drug dealer, no drugs in that house at all. But yeah, they were pretty annoyed about that. They really wanted me to rat and imagine the problem. Imagine if I was easily pressured into that and I did rat. Imagine, let's say it. And my uncle found out. And imagine if it wasn't my uncle. Imagine if it was somebody else, that I'm a person who just went in and bought fucking a bit of weed, coke, crack, whatever from the local drug dealer, was walking away from their gaff. Cops followed me, searched me, pressured me into ranting on them. I was keyed out as the person last coming. Somebody seen me in the cop car. you know, it gets back that I'm the person who ratted. What's going to happen to me? Do you know, the guards don't give a shit. They're delighted. They got their case. They got their boy, their girl, whoever the dealer is. They don't give about the rat. You might get some special treatment if you're a dealer yourself and you're a dealer and you're giving out other dealers. You certainly heard of situations where people got very lenient sentences, let's say, and it was believed to be that they're rats. That happens, but if you're just a normal person just going and buying a little bit of weed or whatever, and they stop and search you and they want you to rat and somebody, they don't really care about you. They're not going to keep you handy. You're not anyway useful to them, you know. Say nothing and a lot of it to the guards. Certainly then, if they're stopping and searching you and all of that crack, they're trying to be your friends. They're not your friends. That's for sure. I've definitely met really nice guards in different situations. Certainly not when I've been stopped and searched. But there is good ones out there, and you know, it's handy when they're there if you actually need them for something that they should be there for. I know Tinkle Tink was saying, you know, they're not able to respond there to certain calls. I think you're pointing out domestic violence. You know, when that call was going in, how many guards were engaged in stopping and searching some young fella for a bit of weed? But yeah, I could stay on here ranting all day. What other points, what other things that I note down here to be going back, looking into? Yeah, the Gardaí, that was the last one, want more resources to fight the last battle. It's like, why would you want more resources to fight the last battle? Just to not, like, they acknowledged it a couple of times actually, that the Gardaí aren't the people to be dealing with the drugs problem. You know, it's a complex one, it's a unique one, I think was the wording that superintendent used at one point in time. But take a complete step back then. It's not your problem, it's a health issue. The illegal trade of it, sale of it, that's a fucking tax and revenue problem, you know. Regulate it and legalise it, legalise it, you know, control it, take it out of the control of the organised crime gangs. Stop drug-related intimidation. How are they so blind to this? I just don't know. You know, drug-related intimidation is a symptom of prohibition. It's not a symptom of drug use. They seem to blame it on drug use, drug dealing, organised crime gangs. No, all of that is a symptom of drug prohibition. So there we go, everybody. Nice one, everybody, for tuning into the stream. Hopefully some people left that a little bit more optimistic. You know, Senator Linderwan out there fighting the battle. Gary Gannon, again, asking good questions, putting it to him. Kind of highlighting some of the hypocrisy there and what's been said. I think Mary Fitzpatrick, in fairness, has asked some good questions throughout these sessions. Let's just hope, you know, when this report is drafted, when the public consultation on the draft of the new drug strategy is finished, let's just hope things are in a better position. You know, let's hope they truly stick to a health-led approach, take away the criminalisation, talk about fucking expungement of criminal convictions that are holding people back, that are still stigmatising people out there, preventing travel and all of that crack. I know I'm one who feels that. Could have went down a road of working in the medical device, pharmaceutical industry myself, production, level 6, GMP qualified, all of that stuff. Could have walked into any of the big blue chip pharma companies around the country, the county, even the city. There's fucking loads of them around the place. But did I? No, because of stigma. I was thinking, no, they're not going to accept me because of my drugs convictions. I'm going to keep going to college. So I didn't give up and just go home and sit in my arse. I said I'd keep going to college and got my honours degree then after that. But certainly, yeah, we need to get rid of convictions. That's a conversation that they need to be having there as well within that drug use committee. Bring the fucking drug user into the conversation, please God. We'll have to get on to the Senator Nicole Ryan, who was missing from today's meeting, unfortunately. And maybe take her up on the offer to be up there more than just a guest, but actually as a speaker. Let's see. Tinkle Tink, yeah, likewise, nice one. And everybody else out there who did take part in the conversation today. Anything else to add? As I've said numerous times, I do hope to get back active on here, get the streams out there on a more regular basis, make more content, just highlighting the hypocrisy and some of the stuff that's been said in these meetings. So the intention is there, just getting around to it just hasn't been possible. Got a wedding being planned for and all of that crack, and a lot of other stuff going on. So until next time, guys, keep it lit, stay blazed, much love, peace. The 420 News logo. Go on, 420 News. Good luck, guys.